Good evening, everyone. We are delighted to have you all here once again. We look we look forward to a fruitful and engaging participation from each one of you. And once again, I welcome our esteemed faculties and organized by Team Ayurveda. So let's make this event a memorable and enriching experience for everyone involved here. And we are excited to showcase a groundbreaking and innovative performance from all of you. And the program is already in a delay. So without spending much time, we can start with our first paper presentation. And for that, I invite Dr. Mitali Dhaval. I invite Dr. Mitali Dhaval.
An Ayurvedic management of female infertility. It is a clinical case study. Myself, Dr. Mitali Dhaval Malgave. I am a PG Scholar Department of Stree Rog Prasuti Tantra. My guide is Dr. T. Vishala ma'am, Professor of Department Stree Rog Prasuti Tantra, Yashwant Ayurvedic Medical College, Kodoli. Introduction is average incidence of infertility is about 15% globally, varies in different population. Some causes can be detected and treated, whereas others cannot. Unexplained infertility constitutes about 10% of all cases. Next slide, please. As we all know, Garbhasambhav Samagri takes major contribution for the conception. Ritu, Kshetra, Ambu, and Bij. These are the four factors which plays a major role in the conception. Next slide, please. Types of Vandatva according to Charak. Vandya, that is absolute sterility and cannot be cured, that is asadhya. Apraja, it is term used to define the type of infertility that can cured and cured with treatment, and the woman is able to become pregnant. Sapraja is defining the woman who becomes afflicted with infertility during her childbearing years after already conceiving one or more children. That is Sukhasadhya Vyadhi. According to Harit, there are 6 types of Vandyatva. Kakavandya, that is has one child, and second time unable to conceive. Anapatya, the woman who has no child. Garbhastravi, the woman who has repeated abortions. Matruvatsa, Mrityavatsa, um, the woman has repeated stillbirths. Balakshayat, infertility due to loss of bala, unexplained, that is Vandya due to Balakshay or Garbhakosh Bhanga. Next slide, please. Vandyatva as a feature of in other diseases such as Putragni, Vamini, Shandi, Suchimukhi, Asruja, Acharna, and Prastravsini. Next slide, please. Prognosis. It depends upon specific causes of Vandyatva. The Vandya described by the Charak as a congenital disease is incurable. Acharya Harit explains that first 5 types of Vandya are curable. Sadhya, Kakavandya, Anupatya, Garbhastravi, Mrituvatsa, and Balakshaya. These are Sadhya. Asadhya, that is unexplained. Ajaspraja. Next slide, please. Management through the Ayurveda. Next slide, please. Principles of treatment, that is Nidan Parivarjan, Agni Dipan, Rasayan Balya, Dhatu Poshak drugs, that is Raktapachak, Rasa Raktapachak or Poshak. Prajastapan can also be used. Tridosh Shamak Chikitsa, that is Vat pacifying. Treatment for the responsible causes like Yoni Vyapat Chikitsa, Shukradosh Chikitsa, and Arthodrushti Chikitsa. Snehan, Svedan, Panchakarma, like Vaman Virechan, Niruha, Anuvasan, or Nasya. Counseling for Saumanasya for the healthy mental state. Next slide, please. Various formulation mentioned in the text. In Charak Samhita, Bruhat Shatavari Gruto, in Ashtang Hruday, Kashmiri Adi Gruto, Shatavari Gruto, or Falagruto, in Ashtang Sangra, Falagruto or Shatavari Gruto, in Bhaishaja Ratnavali, Shita Kalyana Gruto, Priyangvadi Gruto, Soma Gruto, in Sharangdar Samhita, Maharasnadi Yoga, or Shatavari Churno. Next slide, please. Ovarian factors also responsible for the infertility. Anovulation and oligoovulation are also some of causes for infertility. We can use kalpa like ekal dravya like ashoko, shatavari, dashamula, kumari, gugul, harmal, or kalpa like chandraprabhavati, yogaraj gugul, ashokarishta or dashmula in PCOS is one of the major cause nowadays in the for infertility. तो एकलद्रव्य कांचनार गुगुळ लता करंजी वरून और कल्प कांचनार गुगुळ आरोग्यवर्धिनी वटी और पुनर्नवा गुगुळ such कल्प also used in for ovarian factors. Next slide, please. For treatment for anovulation, nurses plays major role in the anovulation. Mahanarayan tel mentioned in the yoga tarangini vatrok prakaran 38 to 47 in form of Nasya and Uttarbasti for failure to conceive, that is effective therapy in this infertility cases. Administration of Nasya, 4 to 8 drops of Mahanarayan can be administered in each nostril for 7 days for 2 consecutive cycles after cessation of bleeding. Mode of action of Nasya, that is Nasya of lukewarm Mahanarayan stimulates the olfactory nerves, stimulates the limbic system and hypothalamus, stimulate the GnRH neurons and regularize the GnRH pulsation secretion, results in the proper gonadotropin secretion that favors the conception and makes the cessation of infertility. Next slide, please. Next slide. Next slide, please. Luteinizing for luteinizing unruptured follicles, Chitrakadi Vati 2 TDS for 3 days after meal or Mustak Churna are also used for the luteinizing unruptured follicles. For tubal factors, Uttar Basti useful for remove tubal blocks, remove adhesions or improve ciliary actions. For Uttar Basti, we can use kalp like Shar Taila, Lashun Taila or Dhanvantar Taila. And orally, we can use Shiguru Gugulu, Yograj Gugulu, Guduchi, Kutki, Punarna or Dashmularishto. Next slide, please. These are the ranges for low image, normal range, below normal age, low or very low range. Next slide. For low image management by Ayurveda, Balya Bruhan Chikitsa Rasayan, Shatavari Churna with Go Gruta, Ashwagandha Kshirapak, Sukumar Gruta, Dhatriadi Gruta, Mahanaran Tel or Yog Basti are we can also administration for the low image. Next slide, please. Endometrial thickness less than 5 mm. This is one of the major cause nowadays for the infertility. For this, we can use Vrusha or Balya Dravyas. Tinan Karma also we can administer. Dadimadi Gruto, Kalyana Gruto, Sukumar Gruto, Phala Gruto or Mahatikta Gruto. Next slide, please. For cervical factors are also cause for the infertility. We can use Yoni Pichu or Yoni Dhavan. For this, in Yoni Pichu, we can use Phala Gruto, Ashok Gruto, Kshar Tel, Kshirpala Tel. And for Yoni Dhavan, we can use Trifala, Panchavalkal Kvat, Varunadi Kvat, or Nimba Kvat. Next slide, please. For psychological factors, Saraswatarishta, Muktapishti, Manasmitra Vatak, Shirodara are administered for the cessation of infertility. Associate next slide, please. For associated therapy, yoga also useful in the infertility, like Brahmari pranayam, Nadi Shodhan pranayam. This plays in the major role in the infertility. Next slide. Thank you.
Thank you, Dr. Mitali. Your presentation was well executed and your choice of topic was excellent, Doctor. Thank you.
Thank you, sir.
Next, I invite Dr. Prakhar Mishra for the paper presentation on the topic Purana Madhu. Dr. Prakhar Mishra, are you there?
Yes, yes. Can I share my screen? Can I be able to share my screen?
Sure, Doctor. We will share for you.
Yeah.
And dear participants, before starting the presentation, let me remind you something. Your maximum time limit for a presentation is 8 minutes. So kindly make sure it. Thank you.
So, good morning, respected judging panel and all the fellow doctors. I am Prakhar Mishra, second year undergraduate scholar from Dhanvantri Ayurveda College, Hospital, Karnataka, presenting a paper entitled Purana Madhu. Without further delay, let us move on to the introduction. As we all know that honey is a nutraceutical product that is produced from honeybees that collects nectar from various flowers and subject to different enzymatic activities in the saliva. Based on the sources, Ayurveda describes 8 different types of madhu. The madhu that has crossed the storage of time of more than 1 year is considered to be Purana madhu, which has many added qualities compared to the Nava madhu. Now let's see the reference from Bhava Prakasha Nighantu, 22nd chapter, where Acharya clearly differentiates the qualities of Nava and Purana Madhu. Nava Madhu Bhavate Pushte Nati Shleshmahara Saram Puranam Grahakam Ruksham Medho Agna Mati Lekhanam Madhuna Shakrascha Gudasyapi Visheshata Ek Savatsare Vratte Puranatmam Smrata Buddhai. Based on this verse, Navamadhu is Pustikara, nourishes the body. Nati Shleshmahara does not reduce kapha to greater extent. Sara, laxative effect, and also aggravates the Tridosha. Whereas Purana Madhu, on the contrary, is considered to be Grahaka, absorbs the fluid contents, Ruksha, creates dryness, Medhoagna, reduces the fat significantly, Ati Lekna, scraping property, and also mitigates the Tridosha. Basically, the honey consists of many phenolic acids and many flavonoids. These constituents aids in the cure of many of the conditions. The Grahaka action of Madhu can be well explained by this research done on the adding of bee honey to oral rehydration, solution in the treatment of gastroenteritis in infants and children. The probable action is explained as follows. Honey has low water content and hence it draws water from surrounding environment, thereby dehydrating the bacteria. Another explain is the action of gluconic acid and some other acids in the honey, which combinedly reduce the pH to its between 3 and 4 and making it hostile for bacteria growth. Medhoagna action. Medhoagna action can be substantiated by the researches on the reduction in weight gain and fat mass. Honey consisting of polyphenols like caffeic acid, gallic acid, etc., and fructo-oligosaccharides causes the inhibition of many factors, which in turn inhibits the fatty acid synthase. This causes the reduction of fatty acid synthesis and thereby reduction in weight gain and fat mass. Whereas Lekhna action is yet another property mentioned in the classics. In contemporary science, we can make use of this property to normalize the lipid profile. The polyphenol present in honey majorly increases few enzymes that causes the fatty acid beta oxidation. Some other polyphenols inhibits the fatty acid synthase. Both of the mechanism result in the reduced fatty acid and triglyceride, thereby normalizing the lipid profile. Because of the Ati-Lekhana property, this can help in treating the atherosclerosis. We need to strictly keep in mind about the precautions while consuming honey. They are as It should not be heated or mixed with hot foods. In summer, intake of honey should be avoided. Do not mix madhu and grata, which is ghee, in equal quantity. Do not take madhu during indigestion. Do not take madhu in excess quantity. Do not drink hot water after taking honey. From all the previously mentioned researches, we can reach to a conclusion that Purana Madhu helps in dealing many lifestyle disorders by virtue of its Grahi, Ruksha, Atilekna, Medhognam properties. I would like to encourage more Ayurvedic scholars to come forward and take up more researches to prove the efficacy of Purana Madhu in further years. Thank you.
Thank you, Doctor, for this short and excellent performance. So next I invite Dr. Neha Pravinkumar Bagave. I invite Dr. Neha Pravinkumar.
First of all, I wish good evening to all the delegates, respectable chairpersons and organizations of the National Seminar Prithvika 2024. My name is Dr. Neha Bagave, PG Scholar of Samhita Department, studying in the final year of LPR Ayurveda College, Maharashtra. Name of my topic is Critical Study of Adharniya Vegas with special reference to purishveg vidharan as an etiological factor to shirashoola. I am delighted to present my topic here in this webinar. Next slide, please. पक्वाशय शिरशूल वातवचो प्रवर्तनम पिंडिकोद्वेष्टन आत्मानम पुरीशेसाद विधारिते. This is the sutra from the 7th adhyay of the Charak Samhita, Navegan Dharaniya adhyay. My study revolves around this sutra. Purishveg vidharan causes pakvashay shul, shirashul, mala apravartan, admanam, and pindikodveshtan. So here my research question is, does the purishveg vidharan works as an etiological factor in shirashula? And my null hypothesis is there is no significant role of purishveg vidharan in shirashula. And alternate hypothesis is there is a significant role of purishveg vidharan in shirashula. Next slide. Introduction. Shirashula is one of the symptoms that occurs due to the purishveg vidharan and also the second most common symptom faced by the people. But still in the clinical practice, this siddhanta of veg vidharan is overlooked by many medical practitioners in their history taking. As patient goes on doing the Nidan Sevan, success in the treatment is delayed and in some cases cannot be achieved. Now we see the shirashula and purishveg vidharan are very common variables. Like everyone from the day-to-day life have faced shirashula and have done veg vidharan at some point in their life. So these unique concept of Ayurveda need to be delved deeper, and it is a unique concept of Ayurveda which should be researched in a more detailed level. Next slide. Review from the literature. Separate adhyayas have been dedicated to the concept of the adharniya vega. In Charak Samhita, elaborate description of the adharniya vega have been given in the 7th adhyay of Sutrasthana, Navegan Dharaniya adhyay. In Sushrut Samhita, we found the description of the adharniya vegas into the Uttarasthana, 55th adhyay of Udavarta Pratishedha adhyay. In Ashtanga Sangraha, Sutrasthan 5th adhyay, Rogan Anutpadaniya adhyay, we found the elaborate description about the adharniya vegas. Next slide. Aims and objective. Aims of my study was to study the adharniya veg siddhanta and to find out the prevalence of purishveg vidharan as an etiological factor in shirashula. My primary objective was to study the role of purishveg vidharan in the samprapti of shirashula, to study the other etiological factors in shirashula, to find out the prevalence of a purishveg vidharan as an etiological factor in shirashula. Secondary objective was to study the adharniya veg from the Bruhatraya. Next slide. Methodology. Adharniya veg siddhanta studied from the Bruhatraya and its all available commentaries. Observational study done upon the patient having the Vyadhi of a Shirashula. Information from the patients collected by history taking and the questionnaire consisting of the relevant questions. And from collected information, whether purishveg vidharan is an etiological factor behind the Shirashula is determined. Next slide. Exclusion and inclusion criteria. My inclusion criteria was patients having a chronic shirashula. Now, why chronic shirashula? Because if we suppress the stool 1 or 2 times, we are less likely to get the shirashula or pakvashaya shul or any symptoms like that. Another factor also patients from the age of 18 to 15 years. The reason behind taking 18 to 15 years of age group was that this age group is more prone to go out, to work, to have more responsibilities. So age group of 18 to 50 years are more prone to do Veg vidharan, and also patients from the both sexes. Exclusion criteria was patients from the traumatic head injury, patients were having ENT disorders or ophthalmic disorders, and the patients of cerebrovascular disorders and nervous system disorders. Next slide. Materials and method. My sample size was 100 and the method was random sampling method. Materials for observational study, we selected patients from the OPD of the institution and through the camps organized by institution. Next slide. This is a study design. Baseline assess. Firstly, we do baseline assessment through the history taking. Then we took the consent, explained the study which is being undertaken to the patients. Then we collected data and statistical analysis and further conclusion drawn out. Next slide. Statistical methodology. Collected data properly tabulated and analyzed, and statistical method applied as per the data collected. Next slide. Okay, assessment tools. Actually, here was my questionnaire that I used for the sake of collecting data. This questionnaire consisted of three part. First part was regarding the shirashoola, where I collected all the information about the shirashoola. In second part, I draw information from the patients about what was the nature of their work, why they were supposed to having Veg vidharan. And in the third part, I also asked the patients, apart from shirashoola, what other symptoms they were experiencing, like where they were constipating, where they were having adhmana, or where they were having pindikodveshta. Next slide. 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 Yes, observation and the results. So we studied 100 patients of the headache, and these are the observations that I found. Out of the 100 of the patients of headache, 70 patients were doing sandharana, 20 patients were having the prajagara, 21 patients were under stress, 16 patients were actively doing addictions like alcohol and tobacco, 43 patients were of pitta pradhana prakriti, 30 patients were of vata pradhana prakriti, and 27 patients were of a kapha pradhana prakriti. Next slide. Statistical analysis. Casper test was applied to the collected data and the observational value I got was of 423.7, which is more than the p-value. Hence, the alternative hypothesis is accepted and there is a significant role of purishveg vidharan in the patient of a shirashoola is proved. Next slide. Discussion from the literary study. Now, purishveg vidharan causes a pakvashayshul, adhaman, shirashul, pindikodveshtan, parikartika, and hrudayoprod. Role of purishveg vidharan in the samprapti of a shirashula. Veg vidharan causes vata prakop. Mainly upon vayu dushti happens. Also due to the veg vidharan, stool remain impacted in the rectum for a longer time. So the dosha present in the stool are reabsorbed in the bloodstream. Here, the doshas which are present in the stool get koshta shakha gati due to the prakopa of apan vayu. If we look at the blood flow of the rectum, superior and inferior mesenteric veins drain all the venous supply from the rectum. So the doshas which are absorbed from the rectum get drained into the superior inferior rectal veins. These superior inferior rectal veins further drain into the main gastric vein and then into the portal system of the liver. Thus, these doshas also follow the same course and they land into the portal system of the liver. They follow the course of the venous circulation and enter into the portal system of the liver, causing yakruta dushti and rakta dushti. Now, if we look at the shirashula, Acharya has said the rakta is the main dusha in the shirashula. So, due to that rakta dushti and yakruta dushti, shirashula is likely to happen. Now, from observational study, out of 100 patients of the shirashula, 70% patients were doing vega vidharan, Maximum patients were from the age 40 to 50 of the age. Females were more in number, that is 57 females and 43 males I found. As the females are Sukumara, they are more prone to do Veg Vidharan due to the shyness. They are more hesitant to use public toilets. Hence, they are more prone to do Vega Vidharan. Pitta Pradhan Prakriti patients were more in number, that is 43, followed by Vata Pradhana, 30, and then Kapha Pradhana. Now, why Pitta Pradhana Prakriti were more in number? So, Pitta Dosha and Rakta Dhatu has a Ashra Ashray Bhav. So, if the Pitta Pradhana Prakriti patients have more tendency to get their blood vitiated and likely to cause headache. 69 patients were doing job, shift duties and had sedentary lifestyle. Now, this job and shift duties and sedentary lifestyle bring about a change in the circadian rhythm of the body. This causes untimely urge to pass the stool, and then the patient starts restraining the stool and thus causing Veg Vidharan. Next slide. Conclusion. In Bruhatrayim, Purishveg Vidharan is mentioned under the Sadrutta Varnanam in the Hetu 7 of various diseases and Sadatura Varnanam. This indicates that the Veg Vidharan must have been very common in the ancient time also. Chi-square test was applied to the observational data, and from the calculation, null hypothesis is rejected and the alternative hypothesis is accepted. Hence, the significant role of the Purishveg Vidharan in the shirashoola is proved. Next slide. Thank you.
Thank you, Dr. Neha. Thank you for the wonderful presentation and for selecting such interesting topics.
Thank you.
Next, I invite Dr. Abha Radheshyamji for the paper presentation. Dr. Abha, are you there?
Yes.
Okay, doctor.
Dr. Abha Panpaliya, PG final year, Panchakarma. My selected topic is Panchakarma aspects in pediatric healthcare. Hello.
You are audible, doctor.
Yes.
Please continue, doctor.
Yes. Introduction. As Shodhan therapy, Panchakarma is said best for uprooting the disease from the root itself. So this principle also holds good for children. Actually, this is very vast topic. Right from Beach Shuddhi, we find the references like Shodhan procedures, Uttar Basti and all. I have selected only the selected procedure in children. So dosh prakop that we say hetus are same in adult as well as in children. So Panchakarma also holds good in children for uprooting the disease from cause. Kashyap advised to avoid excess Shodhan procedures in children with proper justification of indications and contraindications, while Chakrapani suggested to administer the same in Swatantra Bal and to avoid in Paratantra Bal. Next slide, please. It depends on the physical, what makes a child different from adult. So physical conditions of child, that is saukumaryata, alpakayata, vivid anupasevanata, aparipakva dhatu, ajata vyanjana, aklesha sahatva, asampurna bala, and shleshma dhatu prayam. So quality of medicines depends on these qualities. They should be mrudu, madhur and surbhi, laghu, sharkara kalpa, samshaman karma, kapha medohar, and hetu viprit. Next slide. As Trivid Karma mentioned, we can Purva Karma includes Deepan Pachan, Sneha and Svedan. Pradhan Karma, Vaman Virechan Basti Nasya Rakta Mokshan. And Paschat Karma, Sansarjan Rasayan Shaman. Proper age limit is mentioned. Basti is said before 1 year. Nasya is said after 7 years. Vaman and Virechan after 10 years. Rakta Mokshan after 16 years. Kaval and Gandush after 5 years. And Dhumpan after 18 years. Next. First, Purvakarma Deepan Pachan. It is done to obtain Niramavastha of dosh and Kosthagaman of doshas. We can use water boiled with shunthi or dhanyak in pediatric patient. Next, Snehan. Snehan holds, it is said very important in Kashyap Sahita. The reference Leha Adhyay and Naujat Paricharya Adhyay is mentioned. Two types as said in Snehan, Achchapan and Vicharna. In Shirad and Shiranath period, only milk intake is sufficient for oleation. So we can avoid Achhapan. We can use Vicharna here. Next. Some Sadhya Sneha Yoga are given, like vegetable soup, meat soup, cereal soup mixed with Sneha. Regular application helps in good sleep, acquiring strength, proper growth of body and development. As said by Vagpat, Balatel Abhinjan is said one of the resuscitation procedure. Sushrut mentioned various use. They mentioned specifically during summer period. Kashyap has restricted the Snehan in Shirad Avastha. And among the Chatusneha mentioned by Kashyap, growth holds a major role in Snehan as it is the best medium to nourish the brain. And there is similarity between growth properties and brain matter. Only fat and alcohol soluble materials can cross the blood-brain barrier. Next. Some specific growth are mentioned. Shishu Kalyanak growth in Ashtanga Hruday, Ashtamangal growth in Yoga Ratnakar, and Savardhan and Abhay growth in Kashyap. Balatel is said best for Abhyanga according to Sushruta and Vagpat. Indications as included in Purva Karma, various Vatrogas, Rukshata, Hikka, and Krushabalak. Contraindication, Shiradavastha, Chardi, Kafaj Vikar, Sthaulya, Raktapitta, Atisar, Jwar, and Galamay. Charak specifically said Snehan as a contraindication in Graha Pidit and Talushosh. Next, please. Now, Svedan. Svedan, Kashyap has given extensive description of Svedan. 8 types of Svedan are mentioned according to Kashyap. It is used in children suffering from staimitya, kathorta, malabandha, anaha, vani nigraha, rillas, aruchi, alsat, and kampan. Hastasved and Hastasved is said up to 4 months of age, and Patasved is said up to after 6 years of age. Specifically mentioned Shashtishali Pindasved and Annalepan procedure. Next, please. 8 types of Svedan as according to Kashyap. Hasta Sved, Pradeha Sved, Nadi Sved, Prastar Sved, Sankar Sved, Upnaha Sved, Avgaha Sved, and Parishek Sved. Indications, again as a Purva Karma, various Vatrogs like hemiplegia, cerebral palsy, Jadya, Kathinta, Ruksha Sharir, Shwas, Kas, Pratishay, and rheumatic and degenerative conditions. Contraindications, Dagda, Navajwar, Kamla, Pittarogi, Madhumehi, Chardi, Trishna, Karsha, Hriday Rogs, Raktapitta, and Visharta. Precautions, as also mentioned in adult, during Svedan, various articles like pearls, Chandrakantamani, and pots filled with cold water should be placed in contact with Hriday Pradesh of children, and covering the eyes with sheath dravya like leaves of kumud, utpal, padma, or soft cloth. Next, please. Now, Vaman, first karma in Pradhan Karma. The first act of emesis is performed immediately after birth for elimination of Garbhodak using Sendav and Grut. Acharya Kashyap mentioned that babies who emit vitiated milk from stomach repeatedly will never suffer from Kafaj diseases. Specifically mentioned Vacha and Sendav for Garbhodak Vaman. Also, Katfal, Shirish, decoction of Gaura Sarshap, Kritavedan, and seeds of Madanfal are mentioned. In Shiranath, administer drugs along with breast milk. In Annat, quath of Madanfal, Bacha, and Sendo, Katfal, or Sarshap can be used, and dosage varies from 120 mg to 4 gram. Next, please. In case of Vaman being the only option, Sadhya Vaman with Sadhya Sneha and Mridu Vaman is indicated. Normally, in children, 2 to 3 vomiting are appropriate. Ideal drug is Madanfal as we use it. It is said good for Sukumar. And if vomiting is not appropriate, we can use Apamarga, Pippali, Shirish with rice to remove remaining cough. Now, Dravya and doses. Vaman drug given in quantity which is equal to Vidangafal according to Kashyap. 2 to 3 seeds of Apamarga with honey and sugar according to Vaideha Janak. And 2 to 3 pal according to Vruddha Kashyap. As said by others, we can use milk, paste, madhukwat, and lavanodak also. Next, please. Indications. immediately after birth with Sendav and growth. Chronic skin disease, bronchial asthma, psychological disorders, kash, shwas, ajirna, unmat, madhumeha, and kushtha. Contraindication below 6 years of age and in Krush, Trishna, and Shudrik avastha. Next, please. Now, Virechan. Virechan is said contraindicated, but specific age is mentioned if Pitta's disorders and Indriya Shuddhi and functional capacity of Revti is curable by Virechan in childhood practice. In Shiradavastha, Virechan Aushad is given to mother, while in Shirannad and Annad, Anuloman drugs like Haritaki, Trifada, Trivrutta, Aragvat, Falmaja can be given. Indications. Annat balak with persistent vomiting, GBS, Balagraha, Fakka, Kushtha, DMD and ADHD. Contraindications: Krusha, Rajiakshma, Navajvar, Hriday Rog. Tikshna Virechan Aushad should be contraindicated. And complications: dehydration, giddiness, shock, and prolapse rectum. Now Basti. Basti is said very effective and safe in children and can also be employed where Virechan is contraindicated. In childhood, Basti acts like nectar or amrut. Specifically mentioned Kashyap, Kalabasti is said different. In adult, it is in 16 in number, and while according to Kashyap, it is 15 in number. Karma Kal Yog, 30, 50, and 8 in number. And specifically mentioned Yoga is Chaturbhadra Kalka Basti. It is special protocol in Kashyap, 4 Anuvasan, followed with 4 Astapan, and then 4 Anuvasan. Next, please. According to age, it is mentioned, it is the reference from Charak, 1 to 3 years, 30 ml Sneha and 90 ml Niruha Basti Matra, 4 years, 40 ml and 120 ml, 6 years, 80 ml, 240 ml, 12 years, up to 160 ml and 480 ml, and above 16 years, it is 320 ml of Sneha and 960 ml of Niruha Basti. Next. Indications: Annat balak with persistent vomiting, RA, gout, balagraha, fakka, creamy koshta, balapakshaghat, ADHD, GBS, schizophrenia, epilepsy, seizure, and mental disorders. Contraindications: Krusha, and Shunpayu. Complications: pain in abdomen, vomiting, local anal injury. Next is Nasya. Nasya is it is the choice of treatment for disorders above Griva. It is usually contraindicated below 7 years of age. Pratimarsha Nasya is advisable. And 2 types of Nasya are mentioned according to Kashyap: Bruhan Nasya and Karshan Nasya, also said as Puran and Shodan Nasya. Katutel Nasya is specifically mentioned along with Madhu and Gomutra. Next, please. Indications: Vyanga, Ardit, Vatvedi, Shiroshul, Pratimarsha Nasya is indicated. Contraindication: after Raktamokshan, after taking food and water, Kas, Shwas, and acute rhinitis. Next is Raktamokshan. Raktamokshan is contraindicated in children as Rakta Dhatu is said to having function of Jivan Karma. If indicated, the most safe and comfortable mode of method is Raktamokshan, as Jalokavacharan is said for Sukumar. Siraved is again contraindicated below 16 years of age. Next, please. Indications: Vidradi, Gulma, Arsha, Kushtha, Vatrakta, Visarpa, Vicharchika, Netra Rog, Shiro Rog, Kantha Rog, and Ahiputna. Jalokacharan is said best in Pittaj and Raktas disorder like Kukunak and Ahiputna. It may be adopted in Ajagallika, Charmadal, Visarpa, and such other skin disease. Contraindications: below 12 years of age, general debility, cardiac problems, and life-threatening issues. Complication may occur like leech migration, infection, anemia, and allergic reaction. Next. Paschat Karma, Payadi, Karma, Rasayan drugs, and Shaman drugs. It is an inevitable part of Panchakarma. It is used for reduced digestive power after the Panchakarma procedures. Next, please. So, I have selected this topic as main Pradhan Karma are generally masked away by Purva Karma and modalities of like Snehan and Svedan. So we should focus on main Panchakarma, which can be done in pediatric. Also, right from the childhood, if we uplift the disease causing factors, it will be better for their future health conditions. And the newer disease entities too can be successfully treated with Panchakarma once the Dosh Dushya Samurchana is properly understood. Next. Thank you.
Thank you, doctor. So we can go to the next presentation. And I invite Dr. Mayank Dharmendrabhai Patel for the paper presentation on the topic role of dhatwagni in hypothyroidism and its management.
Yes. Yes, I am present. Please share my.
Good evening.
Can you share my screen, sir?
Sure, doctor. We will share for you. Just a moment, doctor. Doctor, please start the session.
Yes. Thank you. Hello, myself, Dr. Mayank Patel from Saptashrungi Ayurved College, Nashik. Next, please. My topic is a role of dhatwagni in hypothyroidism and its management. For introduction, hypothyroidism results when the thyroid gland fail to produce enough of the thyroid hormone due to structural or functional impairment that significantly impairs its output of hormones. That leads to hypothyroidism. Incidence in female and male ratio, male and female ratio 1:6. Hashimoto thyroiditis is the most common cause of primary hypothyroidism. Secondary hypothyroidism can be result of hypothalamus or pituitary glands dysfunction or disease. The main symptom of hypothyroidism are fatigue, weakness, increased sensitivity to cold, constipation, hoarseness, unexplained weight gain, dry skin, hair loss, muscle cramps, headache, muscle weakness, joint stiffness, and memory loss. Next, please. If hypothyroidism goes untreated, the signs and symptoms could become severe, such as swollen thyroid gland, slow thought process, dementia, impaired fertility. The modern treatment is hormone replacement by levothyroxine. Ayurveda has end of function of thermogenesis and metabolism in the body to Agni. There are many main three types of the Agni explained by Acharyas in Ayurveda: Jatragni, Bhutagni, and Dhatwagni, which plays important role in digestion. Jatragni Pak, first stage of digestion, second stage is Bhutagni Pak, and last stage is Dhatwagni Pak, which result in the formation of the Saptadhatu. After reviewing the different texts, it can be conducted that in hypothyroidism, Dhatwagni Mandya is the leading culprit. Agni Mandya leads to formation of noxious form of Dras Dhatu that causes various diseases. Next, please. I am objective to review the available literature in Ayurveda text and correlation with the modern literature on hypothyroidism, to review the Dhatwagni Mandya and Dhatu Pradosha Vikar in the context of hypothyroidism, to review the management of hypothyroidism according to Ayurveda. Next, please. Involvement of Agni in hypothyroidism. Dehagni is responsible for longevity, glowing healthy skin, good body strength and health, excitement in life, well growth, good radiancy, great ojas, normal body temperature, managing various other forms of the Agni. Even the very existence of person is already said to be Dehagni. Normalcy of Agni is must for body function rhythmically. According to allopathic system, metabolic activity of the body is controlled by the thyroid hormone secretion. In Ayurveda, metabolic process of the body are under control of Jatragni, Bhutagni, and Dhatwagni. The cause of disease impaired metabolism can be compared with the vitiation of Agni. Hyperfunction of Jatragni, which in turn affects Dhatwagni, leads to formation of noxious form of Ras Dhatu, eventually brings out pathological sequence and ultimately the disease condition culprit. Next, please. Correlation of ARM with hypothyroidism. ARM plays a major role in the pathogenesis. Jatragni Mandya leads to Dhatwagni Mandya and production of AF. It is the major cause of hypothyroidism. Acharya Vagbhat described the general symptoms of the ARM which may be correlated with the features of hypothyroidism. Clinical features of AF or samne hai symptom of hypothyroidism. Srotoras leads to strength growth and hoarseness of voice. Ballabhrans correlated with general weakness. Gaurav correlated with weight gain, swollen, puffy, edematous face. Anil Mudita correlated with slow heart rate, reduced respiratory rate, inability to concentrate. Alasya leads to lethargy, sleepiness. Apakti correlated with decreased appetite. Malsanga correlated with constipation. Aruchi correlated with anorexia. And Clum correlated with slowing down of the thought process and fatigue. Next, please. Dhatwagni act on the ingested food breakdown into smaller particles, food ingestion and absorption. Bhutagni turns all the vijatiya panch mahabhautik dravyas consumed to sajatiya panch mahabhautik dravyas. Dhatwagni performs synthesis and breakdown of the tissue. Metabolic transformation occur the consumption of food that leads to formation of two parts, prasad and kitta. Prasad gives nutrition to the dhatus and kitta bhag excreted from the body in the different forms. Dhatwagni are considered as a part of kayagni. Increase of Dhatwagni brings dhatukshay, diminished tissue element, and a decrease of Dhatwagni will lead to dhatu vruddhi. In case of hyperthyroidism, patient will lose weight is due to increased dhatwagni, which cause dhatukshay. In hypothyroidism, weight gain is due to decrease in dhatwagni. Their functions have two aspects: one anabolic, next catabolic. Next, please. Dhatwagni mande leads to dhatwagni mande, decrease catabolism, increase anabolism, dhatu vruddhi, and disease condition according to Ayurveda. And according to allopathy, dhatwagni mande decrease T3 and T4, slowing of all metabolic activities inside the cell, acceleration of submetabolicity in cell, weight gain like symptoms, hypothyroidism. Next, please. Thyroxine and Agni. Thyroxine iodine can be considered as Tejo Mahabhutans, so it can be said that thyroid hormones have Agniyans. Dahan, Pachan, Satmikaran are the function of Agni, which can be correlated with metabolic activities in the body. Thyroid hormones control all metabolic activities of the body. Without thyroid hormones from thyroid gland, almost all the chemical reaction of the body would become slow. So they can be considered as a part of Kayagni on which the entire metabolic activities depend on. Every cell in the body has a receptor for thyroid hormone. Hence, thyroid hormones can be considered as Kayagnians. Next, please. The different symptoms of thyroid disorder can be correlated to Rasari Dhatu Dushti Janya Vikar. In Rasa Pradosaj Vikar, anorexia, anemia, irritability, emaciation, premature wrinkle, premature graying hair are correlated. In Rakta Pradosaj Vikar, skin disease, pimples, menorrhagia, leukoderma, Vyang. In Mansa Pradosaj Vikar, goiter, sloughing of flesh. Or in Meda Pradosaj Vikar, sign and symptoms of Pramay. In Asti Pradosaj Vikar, morbidity of hair and head, as well as nails and beard. In Madhya Pradesh, Vikar, pain in joints, giddiness, and in Supra Pradesh, Vikar, impotency. Next, please. Treatment according to Ayurveda, Dipan Pachan, Sodhan, and Dhatu Pradosaj Chikitsa is the main treatment for hypothyroidism. Dipan Pachan for increased Agni, Pachan Avsadis to digest the arm. And in Sodhan, after Dipan Pachan, Sodhan can be done. After Sodhan, Dhatwagni will be normalized, and then the treatment is based on the affected Dhatu. In Rasa Dhatu Janya Dos, Langan should be advice. In Rakta Dhatu Janya Dos, Rakta Pitta Samak Chikitsa, Virechan, Upas, and Rakta Moksha. In Mas Pradosaj Vikar, Sanshuddhi, Shastra, Shar, Agni. In Meda Dhatu Janya Vikar, Chikitsa or Chikitsa of Prame. Asti Dhatu Janya Chikitsa, Basti with Tiktakshir Basti and Gruth. In Meda Sukra Janya, Majja Sukra Janya Vikar, Madhur Tikta, Anna, Vyayam or Vyavai. Next, please. In Saman Chikitsa, what is advice should be Agni Tundi Vati 125 to 250 mg, Arogyavardhini Vati, Chitrakadi Vati, Kanchana Guglu. Churna, in Hingvastak Churna, Saindhavadi Churna, Trifla Lo, Jal Kumbi Basma, and Gandamala Kandan Ras. Pipli Vadman Rasayan also Gruth, Agni Gruth or Karpuraso. Next, please. Patya. Buttermilk, water, warm water, Karvelak, Jangal Masras, Dadin, Dhanyak, Amalki, Grit, Madhu, Shunti, fruit, Patol, Navnit, Nimbu. Vihar, woman, Pathya Vihar, woman, mild Virechan, Svedan, Asan, different types of exercises, Paschimottasana, Vajrasan, Pavan Muktasan, Halasan, Mayurasan, Udayan Bandh, Kapalbhati, Nauli, Makarasan, Uttan Padasan, Sarvangasan, Kapalbhati. Next, please. अपत्य आहार विहार, तीक्ष्ण विरेचन, सीतंबु सेवन, अति अंबु पान, वेग धारण, रात्रि जागरण, रक्त मोक्षण, समिधान्य, विषमासन, अनुपमास सेवन, आलूक और कुकुम्बर और गुरु वृक्ष आहार. नेक्स्ट प्लीज. Inactive T4 is converted into the discussion. Inactive T4 is converted into active form of thyroid T3. About 20% of T4 is converted to T3 in GI tract in form of T3 sulfate and triiodoacetic acid. The conversion of T3 as T3AC into active T3 requires an enzyme called intestinal sulfatase. This intestinal sulfatase is released from healthy gut bacteria intestinal dysbiosis as imbalance between pathogenic and beneficial bacteria in the gut significantly reduces the conversion of T3S and T3AC to T3. Thus, poor gut health can suppress thyroid function. Agni is the prime factor for causation of the disease, including hypothyroidism. Metabolism, catabolism, transformation, digestion, discretion of toxins all are brought about by Agni. Agni in body is responsible for good health, strength, luster, and longevity of life. Next, please. If the Agni of person is vitiated, the whole metabolism in this body would be disturbed, resulting in ill health and disease. Thus, Agni act in the same way as thyroid hormone does for the body. In the context, an alternative approach with the principle of Mandagni in Ayurveda shows promising results. Since the hypothyroidism, the main underlying pathology is hypometabolism, if seen to fit into the concept of Agni Mandak given in Ayurveda. In modern medical science, there is no absolute cure of the disease, but Ayurveda can be ray of hope in such cases. Ayurveda aims not only all alleviating the symptoms, but can act on the original root cause. The treatment of hypothyroidism is Pachan, Dipan, Anuloban, Saman Chikitsa. In patients with hypothyroidism, adopting healthy food habits and lifestyle dependency on hormones can be settled. Next, please. Thank you.
Thank you, doctor.
Thank you, doctor. Thank you for this innovative performance. And next, I would like to invite Dr. Madhulika Ranabahadur Singh for the paper presentation.
Hi, I'll share my screen. Please give me a moment.
Sure, doctor.
Good evening, everyone. I am Dr. Madhulika Singh, MD Scholar from Swasthivritta Department in College of Ayurveda and Research Center, Nigri, Pune. My topic of the paper presentation is correlation of baby-led weaning with Ayurvedic principles. What is the objective of my study? To understand the characteristics of baby-led weaning with an integrative scientific literature review with Ayurvedic principles to identify their correlations. Let's understand the background of this study. So baby-led weaning, also known as BLW, it is an approach where solid food is introduced to infant when they are ready for solids around 6 months of age. And in this particular method, baby is self-feeding themselves rather than a parent or a caretaker spoon-feeding the purees to the baby. This paper explores the correlation between baby-led weaning and Ayurvedic principles, focusing on different aspects like nutritional, developmental, and holistic. Ayurveda, an ancient Indian system of medicine, it emphasizes balance and natural approaches to health and wellness. By examining the parallels between BLW and Ayurveda, this paper aims to shed light on the potential benefits of integrating traditional wisdom with modern feeding practices for infant health and well-being. So WHO has recommended that till 6 months of age, they should be the baby should be breastfed exclusively, and around 6 months when they are ready for solids, because of the need of the more energy as they are moving around, starting to crawl and walking, eventually there is a need of more nutrition, and thus it's a very crucial milestone when they are introduced with the solid. Baby-led weaning is a method which has gained popularity in nowadays because of change in the time. As mothers are into different professionals, there are nucleus families around. So this approach is getting more and more popular, mostly in the Western countries. And now because of the social media, it is also becoming popular in India. There are chances in our practice, parent can come and ask us if BLW can be taken into consideration rather than the traditional weaning, and we as a practitioner must understand if we can apply our Ayurvedic principle to it to govern our answer. So let's see how BLW and Ayurvedic principles intersect to each other. What is actually baby-led weaning? So it is a method, as we see, that where solids are introduced to babies, where they are hand holding the food instead of spoon feeding by any other adult. The main principles of BLW are that babies are allowed to choose what to eat. We give different food to them and they choose what to eat and what not to eat. Babies are allowed to explore the food with their bare hands. They explore the textures, they explore the different consistency of the food. Children decide how much they want to eat. When in a traditional feeding, when other people are feeding the baby, it's their call that how much to feed them. Even if baby is not hungry, obviously a small baby can't talk and they can't tell that if they are hungry or not. They can just resist the food, but parents still go on feeding the food. But in BLW, the approach is that uh, children decide how much they want to eat. There is no forceful eating there. Encourages to include variety of food. In the purees, we take one or two food, we can mix them and we can feed the babies in the form of puree. But when we are including the solid food, a variety of food can be introduced to them. And the main principle is allowing babies to guide the food into their mouths on their own. So this uh, proves the term for this baby-led weaning, where baby is transitioning from milk to solid by his or her approach. What are the benefits of BLW? One of the major benefit is motor skill and oral development. Motor skill is that the baby is exploring the food by its hand. He or she is taking the food to the mouth. The motor skill is developing here. They are grabbing the food, they are breaking the food. The motor skill is developing. And when they are putting the food in the mouth, they are biting through their gums or teeth, or they are moving their tongue in different directions in the mouth to uh, move the bolus of the food. And the swallowing, the different texture will need different they are swallowing and they are learning how to swallow while having a different texture, where in the traditional weaning we don't get this. Appetite control, again, a baby will decide how much he wants to eat. Family meals, the baby BLW insist to have a family meal. Not a separate food should be made for the baby, but they should feed from the family pot. Independence, baby is learning on its own how to eat the food and not dependent completely on a caretaker to feed him or her. Associated with the development of food preferences, eating behaviors, and body weight in childhood. So whatever varieties we are giving in the childhood, the food picking eater in the later age is reduced tremendously in the BLW pattern. BLW can also be seen as a way to encourage early decision making and autonomy in children, similar to how certain yoga practices promote mindfulness and self-awareness. Ayurvedic concept of Anna Sanskar. So Ayurveda has not explicitly mentioned the term Anna Sanskar, but they provide a lot of information related to the principles of food preparation, consumption, and dietary practices that align with the concept of Anna Sanskar in Ayurveda. Ayurveda recommends that the first solid foods introduced to infants should be easily digestible, well-cooked grains such as rice or wheat, mashed fruits such as bananas or cooked apples, and lentil soups. These foods are considered to be gentle on the infant's digestive system and provide essential nutrients for growth and development. When introducing solids to infants, caregivers are advised to prepare foods in a way that optimizes digestibility and supports the infant's developing digestive fire, which is known as dhatwagni. Let's see what can we correlate the Ashta Ahar Vidhi Vishesh Ayatan with BLW principles. So these are the left hand gives the 8 Ashta Ahar Vidhi Vishesh Ayatan: Prakriti, Karan, Samayog, Rashi, Desh, Kal, Upyog, Sanstha, and Upayokta. Let's correlate it with BLW. Prakriti. So Prakriti means how the food is having the gun and its virya, or what is the prakriti of the person who will be eating the food. Here in BLW, they are focusing more on the hunger tendency. If a baby is hungry, then only a food should be given. It should be given as per their need. Karan means the processing of substances. Here in BLW, they are enhancing to give the variety of texture and not just stick to a puree form. Samayog means combinations, different food they are combining, and Ayurveda emphasizes to give different combinations of the food. For example, should be included in our diet. So in BLW, they insist of using different spices, multiple ingredients, like they insist in creating uh, a complete meal rather than just giving a puree form. Rashi, quantity, again a child decides here the quantity and not the caretaker. Desh, uh, where it is recommended as per the Desh, the seasonal fruits or seasonal food should be inculcated. Here in BLW, again, they insist to give the seasonal food mostly. Kal, um, in BLW, they insist very specific time should be followed when a baby should be fed, when their hunger cues are present, when they have breastfed, or everything is taken into consideration to decide their meal time. Upyog Sanstha means there are several dietetic rules. So even BLW have many dietetic rules, such as no distraction should be there while eating, which we are commonly seeing that most of the children are eating only when the mobile phones are given to them. So this is against the BLW. We see in the traditional weaning that children is roaming throughout the home, and the caretaker is running behind them and feeding. But here in BLW, they say that they should be seated at one place. They have high chairs, they have to sit at one place, and then they should be fed. Upayokta means the users. So obviously BLW itself, it has a name that it should be baby led. So it completely depends on the child. Nutritional aspects. Ayurveda recognizes the importance of proper nutrition in supporting optimal growth and development, particularly during infancy. BLW also encourages the introduction of variety of whole food, which is rich in essential nutrients, aligning with Ayurvedic dietary recommendations. Both approaches emphasize the consumption of fresh, seasonal, and locally sourced foods to enhance nutrient bioavailability and promote digestive health. Additionally, BLW allows infants to intuitively select foods based on their preferences and nutritional needs, fostering a balanced and diverse diet consistent with Ayurvedic principles. What are the developmental considerations here? So BLW advocates argue that self-feeding promotes the development of motor skills and hand-eye coordination and oral motor control in infants, where oral motor control also helps in speech development. Ayurveda similarly emphasizes the importance of sensory experiences, including taste, touch, and smell. BLW is allowing to explore the food by their hand, taste, touch, and smell. It uh, can be correlated. By allowing infants to explore food textures, flavors, and aromas independently, BLW aligns with Ayurvedic principles of holistic development. Furthermore, BLW encourages a positive feeding environment characterized by responsive feeding cues and mutual trust between caregivers and infants, fostering emotional well-being and psychological resilience, concepts central to Ayurvedic philosophy. Holistic wellness, Ayurveda views health as a dynamic equilibrium involving the integration of physical, mental, and spiritual dimensions. Similarly, BLW emphasizes a holistic approach to infant feeding, acknowledging the interplay between nutritional, developmental, and emotional factors. By empowering infants to actively participate in mealtime rituals, and it should not be a forceful, they self-regulate their food intake. BLW supports the cultivation of healthy eating habits and positive associations with food from an early age. This holistic perspective resonates with Ayurvedic principles of mindful eating and conscious living, emphasizing the importance of nurturing body-mind harmony for overall well-being. Let's see about this Saman Vayu Mudra. So if you see the picture, we can see that this is the way we hold our food when we are eating through our hands. This is similar to Samanvayu Mudra. As per Ayurveda, we know Samanvayu is very much important related to the digestion. It increases the digestion, it increases the Jatharagni, increases the assimilation and metabolism in the body. So when a child is understanding, it's learning to hold his hands in this way and eating the food, it is indirectly it is indirectly forming the Samanvayu Mudra, and even we are forming the Samanvayu Mudra when we are eating, and we are helping our digestion to enhance our assimilation and metabolism. And when we are feeding it with a spoon or something, then somewhere this is hampered. What is the conclusion of the paper? So overall, if Ayurvedic texts may not provide explicit guidelines akin to modern recommendations on starting solids, but the principles of Ayurveda offer valuable insights into nurturing the infant's digestive health and overall well-being during the transition to solid foods. Baby-led weaning exhibits significant correlations with Ayurvedic principles, particularly in terms of nutrition, development, and holistic wellness. By embracing the natural wisdom inherent in both approaches, caregivers can optimize infant feeding practices to promote health and vitality according to age old traditions and contemporary evidence. Further research is needed to explore the long term effects of integrating BLW with Ayurvedic principles. Ultimately, by bridging ancient wisdom with modern insights, we can foster a holistic approach to infant feeding that honors the inherent wisdom of both traditions. Thank you, everyone.
Thank you, doctor. One more poster presentation is there.
Yes, I'll just open that and share my screen immediately.
Okay, doctor.
Okay. So I will be also presenting poster. The topic of my poster presentation is breathing life, the role of pranayam in prenatal care. So we all know that pranayam is one of the limbs of Ashtanga Yoga, and it offers a very powerful tool for promoting well-being. This can be very safely inculcated in our pregnancy also. This poster is going to explore the benefit of incorporating pranayam into prenatal care, highlighting its potential to support physical, emotional, and spiritual health for expectant mothers. Objective is to systematically review the literature on the role of pranayam during pregnancy, evaluating its effects on maternal health outcomes, fetal well-being, and pregnancy-related discomforts. The methodology involves a comprehensive search of electronic databases and manual searches for studies on pranayam during pregnancy. Selected studies were assessed for quality and relevant data were extracted and synthesized to identify trends, key findings, and implications for practice and research. What were the scientific evidence which was withdrawn from all the review of literature? So, research have demonstrated that the positive effect of pranayam on maternal health includes reduced anxiety levels, improved sleep quality, enhanced maternal fetal bonding. A systemic review by Sharma from 2019 concludes that a pranayam practice is associated during pregnancy, which decreases the incidence of preterm birth and low birth weight infants. Longitudinal studies have shown that expectant mothers who regularly practice pranayam experience shorter labor durations, decreased need for medical interventions, and improved postpartum recovery. These are the 3 recommended pranayam for pregnancy, which can be very safely included. Dirgha pranayam, Nadi Shodhan, Brahmari pranayam. So if you see the picture here, Dirgha pranayam, so inhalation, during the inhalation, it starts from the belly and ends at the chest, or you can say the neck area. So while inhalation, a belly area is expanded, then the ribs area, the thorax region, and then the upper chest area. And while exhaling, we start by bringing our chest area to the normal shape, then the ribs to the normal shape, and then the belly. This is also known as deep breathing. How does it help in pregnancy? Is that if you know, in the later trimester, in the end of the second trimester and throughout the third trimester, many pregnant ladies complain of the shortness of the breath. So when this Dirgha pranayam is practiced from the day 1, or you can say from the first trimester of the pregnancy, they get used to deep inhale and exhale, and the shortness of the breath can be reduced very tremendously in the third trimester in such kind of pregnant ladies. Second is the Nadi pranayam. It's similar to, or we can say we call it also Anulom Vilom Pranayam, where alternate nostrils are used to inhale and exhale. This have a very calming effect on mind and it reduces stress very nicely. The third is the Brahmari Pranayam, where the ear are closed, eyes are closed, and the mouth is sealed. The lips are closed properly. Inhalation is done from the nose and exhale while making a humming sound. This also have a very good effect on the nervous system. It calms the nervous system and includes a sense of inner peace and serenity. So let's say what are the benefits of the pranayam during pregnancy. So stress reduction. So pranayam such as Anulom Vilom, Brahmari pranayam, they play a very good role in reducing the stress. Improved oxygenation, the deep breathing and the conscious breathing helps to intake lot of oxygen, and it helps in the circulation and provides good amount of oxygen to the fetus also. Pain management, mostly breathing process is something which we are doing involuntary, we are not focusing on that, but when a mindful breathing is practiced, it really helps in alleviating the pregnancy related discomforts such as back pain, nausea, insomnia, etc. Emotional balance, where due to the many hormones present in the pregnancy, lot of mood swings are present. Pranayam fosters in emotional resilience and enhances mood stability. What should be the safe and effective practices here? So the pranayam practice should be very gentle and very mindful, and it should be tailored to individual and individual's needs. Expectant mothers are advised to practice this under the guidance of a profession, and it is essential to listen to the body signals. If any overexertion is there, or if any discomfort is there during the practice, it should be immediately stopped. Precautions and considerations. So there are certain medical conditions or high risk pregnancies where some pranayams cannot be performed. Any kumbhak where we are retaining the breath or vigorous breathing should be avoided, like Kapalbhati, because they increase the intra-abdominal pressure and they strain the pelvic floor muscles. Practice of the pranayam should be done in a well ventilated space. If any lightheaded or dizzy feeling is there, they should return back to the normal breathing. So what was the result? Pranayam during pregnancy reduced maternal stress, improved oxygenation and alleviated discomforts. Fetal well-being trends were positive, though not statistically significant. Quality assessment indicated moderate to high methodological rigor. Pranayam shows promise for enhancing prenatal care. Conclude We can conclude this as pranayam practice offers a safe, accessible, and effective means of enhancing well-being during pregnancy. By incorporating mindful breathing techniques into their prenatal care routine, expectant mothers can cultivate health, harmony, and inner resilience, supporting a positive pregnancy and birthing experiences. These are the references. Thank you, everyone. I'll stop sharing.
Thank you, Dr. Madhulika. Thank you for
Thank you,
delivering
doctor.
such an informative and engaging paper and poster presentation. Next, I invite
So,
Dr. Payal Subhash Nirmal for the paper presentation. Dr. Payal, are you there?
Yes.
and before going to the next presentation, again, I would like to remind you your time limit. Dear all, please do follow your time limit.
Hello, I am Payal Subhash. I am from PMT with Shirashoola. My topic for paper presentation is the efficacy of Virechan in Chikitsa and Namaste. Acharya Kashyap initially provided detailed description of Amla in separate chapter. The causes and pathophysiology of Amla are described in anesthetic classical work Charak Samhita. Amla is split into two categories. Udbhav Amla and Adho Amla based on the clinical characteristics. This disease and hyperacidity may connected illness called as a hyperacidity, drought on a poor digestion lifestyle and dietary choice, heartburn, chest pain, gastric discomfort, abdominal distension,
food reservation, nausea, decreased appetite, etc. The disease Amlapikta is a common functional disease of the unnervous water due to Nida segment development of pitta increase, which leads to Agni Manja. Thereby, indigested food become Vitaka and symptoms like Amlodar, Urdu, Aruchi, etc. Evident clinically. In modern medicine, antacid like H2 receptor broken from inhibitor used for treatment. Antacid are a drug that helps manage the symptom pain, discomfort caused by heartburn, acid reflux. They work by neutralizing the stomach acid, irritates stomach, etc. The proton pump inhibitor reduces the production of the acid by blocking enzymes in the wall of stomach that produce antacid. But long term of this medicine cause side effects like headache, diarrhea, constipation, abdominal pain. Aims and objectives: study the role of Virechan in management of Amlapikta and Drakshati grit in shaman PTC. Material. In present study, patient diagnosed of Amlapikta selected in OPD and taken for the study purposes. पूर्व कर्म, प्रधान कर्म and पश्चात कर्म. Here we take ghee, arul matra, for Sneha Rajendra and Virechan. We select the 3 Vritha Uryan. After completion of the Virechan part, पश्चात कर्म, then shaman chikitsa drakshadi 10 ml PD. Inclusive and exclusive criteria. Patients will be selected irrespective. Assessment of the subjective parameters. Avipa, plum, Tiktamrudra, Ritavantada, Aruchi, Agni, Gaurav. There are some investigations: blood hemogram, urine microscopic, food routine and microscopic. There are some observations. Do and don'ts. Will advise take light diet and don't not heavy food, spicy food. Discussion Amlapikta is a disease of unnervous voters. Unnervous voters plays important role in development of disease. Rogaha Sarva Agni Manja. Acharya Kashyap says Mandagni is responsible for development of Amlapikta due to variation of Agni Prakriti. Pachak Pitta Avastha gets converted into liquid Pachak Pitta. Avastha gives rise to the Amlapikta due to alteration of the food habits, changing lifestyle, additional of the drug. Hence, shaman chikitsa we select the Drakshadi. Conclusion: dietary precaution is necessary in case of Amlapikta. Acharya says stomach is divided into 3 parts: 1 part for food, 1 part for water, and 1 empty for digestion. Eating heavy food material leads to slow digestion and requires more time. So, light healthy diet is necessary for improved condition. There are some references. Thank you.
Thank you, doctor. Next is a paper and poster presentation. I would like to invite Dr. Seema Shivajrao Sathe for the paper and poster presentation. Dr. Seema, are you there?
Yes, sir. Yes, I will share my PPT.
Okay, doctor.
Good evening all. I am Vaidya Seema Sathe from SSAM Hadapsar, Pune. My topic name is Ekal Dravya Chikitsa in Vatarakta, Ayurvedic review. Vatarakta, classified as a Vata predominant Vyadhi with Rakta as a main dusha, manifest as piercing joint pain resembling a rat bite. The symptoms of Vatarakta are severe pain, inflammation, tenderness, and burning sensation, particularly in the small joint of hands and feet. The incidence of gout is rising steadily. Current modern medical treatments for gout include NSAID, corticosteroids, each with limitations, side effects, and drawback. Plant-based medicine seems like a good option for treating gout always. Numerous Ayurvedic texts mention various medicinal plants for Vatarakta treatment. This paper aims to compile medicinal plant recommended for Vatarakta treatment across diverse Ayurvedic literature. 26 medical plants have been identified from Sanhita, offering a potentially more effective and less side effect prone approach to Vatarakta management. Introduction. Ekal means it is a Sanskrit word meaning alone, single, solitary, or sole. Thus, grammatically, Ekal Dravya Chikitsa means treatment with a single dravya or a single dravya as a primary ingredient. Ayurvedic doctors often prefer usually minimal medicinal substances to treat clinical conditions. 26 clinical conditions. It is better to use minimal substances rather than combining multiple herbs because of concern about cost, availability, adulteration, and impact on biodiversity. 26 Ekal Dravyas have been collected from different sources, offering a potentially more effective and less side effect prone approach to Vatarakta management. Here are some details about my paper presentation: aim, objective, materials, methods, observations, and keywords. My aim is to compile medicinal plants recommended for Vatarakta treatment from classical Ayurvedic literature. These are some drugs used in Vatarakta in Charak Sanhita with their botanical name, common name, family, and parts used. In Charak Sanhita, Guduchi, Shaliparni, Eranda, Pippali, Haritaki, Rivrutta, Bala, and Ashwatha are used as a Ekal Dravya. Similarly, in Sushruta Sanhita, Mulethi, Prishniparni, Guduchi, Haritaki, Pippali, Amalaki, Mangrela, and Karavellak are used. In Ashtanga Sangraha, Shigru, Trivrutta, Eranda, Bodhuma, Punarnava, Pippali are used in Vatarakta. Similarly, in Ashtanga Rudaya, Haritaki, Kokilaksha, Til, and Guduchi are used as a Ekal Dravya in Vatarakta management. Now we will see the yogas in detail. Here are the treatments mentioned in classical Ayurvedic text along with their references. In Charak Sanhita Chikitsastan 29th Adhyay, Guduchi Swaras Siddha Gruta or Kshira is mentioned. Guduchi is best drug of choice in Vatarakta. It is called also a Vyadhi Pratyanik Dravya. Then Shaliparni Siddha Kshir with sugar. Shaliparni pacify all three doshas. Eranda Tel with milk. Eranda is called as Vatari and it is used in Bahudosha Avastha. That is when excess doshas are accumulated in the body. Then Haritaki, decoction of Haritaki fried with ghee. Haritaki is used with ghee to avoid consequent vitiation of Vata by its Rukshatva. That is Vatanupalayan. Trivrutta powder with milk or grape juice is used as Trivrutta is best Sukha Virechak Dravya in Agra Sangraha and it removes obstruction by excretion of mother and pacify aggravated Vata dosha. Then oil prepared with decoction and paste of Bala and decoction of Ashwatha with honey. Ashwatha is used in overcome Daruna Tirodoshaja Vatarakta, that it overcomes shortly even severe Vatarakta. Now we will see the yogas given in Shushru Sanhita Chikitsastan 5th Adhyay. Mulethi with goat milk and oil. Prishniparni Siddha goat milk with sugar and honey, decoction of Guduchi Haritaki with Guda, Pippali with milk on water, Amalki Ras Siddha Purana Gruta, Mangrela Siddha Gruta, Karavellak Siddha Gruta. Prishniparni pacify all three doshas. Here Haritaki with Guda is a very simple yoga and that can be used in all type of Vata Rakta. Pippali is used in Ardhaban Matra. In Ashtanga Sangraha, external application of Shigru Mul with Gruta is used in Kapha Pradhan Vatarakta as due to its Ushnatva. Trivrutta powder with milk, erand oil with milk, external application of Godhum Churna with goat milk to relieve the pain. External application of Punarnava with Gruta as it reduces the swelling. Pippali in Vardhaman Matra. In Ashtanga Rudaya, decoction of Haritaki fried with ghee, Kokilaksha decoction and vegetable, external application of tila with milk and decoction of guduchi. Kokilaksha here used as a medicine or as well as diet also because due to diet it increases dhatu bala and Kokilaksha is having Madhura Amla Tiktaras, which is a rare combination and it is used when there are Mansik Hetu like Krodh. Till due to its Guru Snigdha Madhura Ushnagun, it is helpful in maintaining Vata dosha also. Discussion. The utilization of single substance has been observed across the various diseases in a range of formulations, either in different anupans or in process form. A single dravya can be used in different forms according to diseases. Also, it can be used in different diseases only by altering its anupan accordingly. Single substance processed with ghee, milk, or oil may either increase the potency of a single substance and help to achieve optimum result. Conclusion. Comprehensive list of medicinal plants from classical Ayurvedic literature have been compiled. Like in Charak Samhita 8 plants, in Sushruta Samhita 8 plants, and in Ashtanga Sangraha 6 plants are noticed. In Ashtanga Rudaya 4 plants are mentioned for the treatment of Vatarakta. Overall, 26 plants have been identified in classical Ayurvedic literature for their potential efficiency in Vatarakta treatment. Here are some references from Charak Samhita, Shushruta Samhita, Ashtanga Sangraha, and Ashtanga Rudaya. Thank you. Now I will present a poster. My poster topic name is Lok Purush Samya Siddhanta. Aim is to study the Lok Purush Samya Siddhanta. Objective, to study the similarities of humans with the universe about structure, function, and pathology. Profound similarities between the outside world and an individual have been observed. In short, human is a small replica of a universe. This is called Lok Purush Samya Siddhanta, which is one of the fundamental principles of Ayurveda on which all other principles are based. Here are some references from classical Ayurveda Samhita. In Veda, the reference of in Veda, Yat Pinde Tat Brahmande, Yat Brahmande Tat Pinde means component of universe are similar to component of humans. In Charak Samhita, Charak Sharir San, 5th Adhyay, यावंतो हि लोके मूर्तिमंत भाव विशेषः तावन्तः पुरुषे यावन्तः पुरुषे तावन्तः लोके इति. That means any living body is a representation of universe. Similarly, in Shushruta Samhita, Visarga Adana Vikshepahi, Soma Surya Anilastata, Dharayanti Jagat Deham, Kapha Pitta Anilastata. That means Soma, moon, is responsible for giving strength. Surya, sun, takes out energy, strength, and Anil, Vayu, is responsible for movement in the universe. Similarly, in the body, Kapha, Pitta, and Vata do these functions. Now we will see some examples related to this topic. First, we will see anatomical example which are clinically applicable too. In Loka, we have Karavella, which has structural similarity with that of Agnashe. That means it is used in pancreas related disorder like diabetes. It is best drug of choice that has been prescribed. In Lasun has structural similarity like Amashe, which is used in gastric abnormality. Then we will see Kanchana. Kanchana has structural similarity with thyroid disorder. Therefore, it is used in thyroid related diseases. Then we have Mondukaparni in Loka, which has structural similarity with Mustulinga Majja in brain, which is used in improving Medha or IQ. Now we will see some physiological example. In Loka, you have Bija Abhisamskar, where there is a growth of certain seed to the biggest tree or plant under the influence of Vayu. Similarly, under the influence of Vayu in the body, there is a formation of Garbhakruti. Then we will see in Loka, you have something called as a blossoming of flower, which can be related with function that is called as Unmesh Nimesh, that is opening of eyelids. Then we will see narrow flowing of lake in Loka has similar structure in Srotasa with content. That is likewise narrow flowing lakes in Loka, our body have certain channels like artery, any kind of blood vessels. Now we will see some pathological examples. In Loka, you can see abnormalities like earthquake. In Purusha body, there is some same type of disorder which is named as Sharira Kampa. In Loka, there is drought, and in Purusha, Rasakshaya Raukshata, where there are crackles present in the skin. Similarly, in Loka, you have volcano where there are eruption of lava from core of earth. In body, Urdhvaga Amla Pitta, where the acid in the stomach is directed upward. In Loka, we have Asti Sanharak drug, which is used in Astiksha in human body. Conclusion: any changes occurring in the universe causes structural functional changes in the body. Hence, changes in the normal structure and functions of universe play important role in cause and development of disease and or abnormal condition. In the treatment of different disorders, this theory is widely applicable and utilized. Thank you.
Thank you, doctor. So next, I invite Dr. Ashish Kumar Ajay Kumar Mishra. I invite Dr. Ashish Kumar Ajay Kumar Mishra for the paper presentation.
Good evening, everyone. Am I audible? Hello.
Yes, good evening, doctor. You're audible.
Yes, good evening, everyone. So I am presenting a poster. Wait, I'll share my poster. Can you help me with this?
Yes, doctor, we will share for you.
Hello.
Doctor, please start the session, doctor.
Sorry, huh. So my topic is suture material and suture needles. These are the basic thing for surgeons to start with. So there are these are the suture materials. Sutures are the thread or any substance which used in the approximation of tissues or surfaces like skin or any body tissue. Types of suture material are first is the nature of material, the absorbable and a non-absorbable. In that, natural and synthetic. Then strength of the material means nature of the material, that is straight or not pull strength. Then filaments of the thread, monofilament and polyfilament. So these are the examples of filaments. Monofilament, that is single coated. Example is the silk and nylon, etc. Multifilament coateds are vicryls, which are good in strength and knotting purpose. Braided, that is again braided silk and twisted ones. Then the classification of absorbable and non-absorbable. Absorbable sutures are naturals are catguts, plain and chromic, and with this synthetic vicryl, dexon, and monocryl, which is used sometimes PDs also. Non-absorbable silk, polypropylene, polyethylene, cotton, linen, and nylon. In this, silk and nylon are basically used and sometimes led into ligate vessels and arteries. Then surgical needles. The surgical needles are the very sharp instruments which used to puncture and guide the thread, wire, or any kind of sutures to ligate the vessels or approximate the tissues. So there are types of needles, the needle with an eye or without eye, and a shape of needle, straight or curved. So curved has two types, single armed and double armed. And according to edges, there are a round body, which is used inside the tissues, and cutting body, which is used to approximate the skin because of that sharpness. And cutting has two types, conventional cutting needle and reverse, which is reverse cutting used in tissues like uh, nasal cavity, filaments, ligaments, mucosas, means some soft tissues. Reverse is used in soft tissues, and taper point, which is used in aponeurosis approximation and muscles, nerves, etc. Then there are, according to tip, there are triangular tip needles, round and blunt point needles. One example is shown. So this is ethlon, and almost all the numbers are mentioned. So 50 is the gauze of the tissues, and length is 19 mm, and a needle type as shown in this. And this ethlon is polyamide, that is suture material, and a brand name is Ethicon, and everything is shown in this picture. So with this is the little basic of the suture material and suture needles. Thank you.
Thank you, doctor. So now I invite Dr. Divya Dattaram Baikar for a paper presentation. Dr. Divya. I invite Dr. Divya Dattaram. Dr. Divya Dattaram, are you there? If so, please respond.
Okay, next I invite
So next,
Dr.
I'd
Nidhi
like to
Kamble
invite
for the paper
Nidhi Kamble.
presentation. Dr. Nidhi Kamble, are you there? Dr. Nidhi Kamble, are you there? Okay, next I invite Dr. Ayushi Adul Joshi for the paper presentation.
Yes, I'm here.
Okay,
Am I
doctor.
audible?
Yes, doctor, you're audible. Please
Okay.
share the screen, doctor.
Can you share the screen for me?
Sure, doctor. Just a moment.
Okay, thank you.
Hello, Dr. Aishi.
Yes,
Please
hello.
start the session, doctor. Please start the session.
Yeah, okay. So a very good evening to all of you. I'm Dr. Ayushi Joshi, and I start my presentation with the name of Sri Dhanvantari ji. So next slide, please. So my topic is effect of Jalokavcharan in the management of external hemorrhoids, which is a case study. Next slide, please. So introduction. According to Ayurvedic text, ursh is defined as mass kill as it obstructs an opening, anal opening, causing pain during defecation like an enemy. Some important causes are sedentary lifestyle, irregular bowel habit, prolonged straining, and low fiber diet. Ursh can be compared with modern hemorrhoids, which is the dilatation of the hemorrhoidal plexus of veins situated in the lower portion of the rectum and in the subepithelial region of anal canal. Next slide, please. Acharya Sushruta has described ursh as Rakta Mas Pradoshaj Vyadhi. He has told the signs and symptoms like pain, swelling, bleeding. Jaloka Avcharan, which is mentioned as one of the most important tools for the management of external hemorrhoids, as it relieves venous pooling of blood in that area by locally dissolving the clotted blood. Application of leech provides thrombolytic, anti-inflammatory, local analgesic action along with significant improvement to the patient. Next slide, please. So the aim of this study was to study the effect of Jaloka Avcharan in the management of external hemorrhoids. Case report. So I have taken a male patient of age 52 years having complaints of mass felt at anal region, constipation, and mild pain at anal region. Next slide, please. So the past history of this patient was when the patient came, he was having the complaint of mild pain and mass felt at anal region. He was examined, and during examinations, it was found that the bulge was felt in left lateral position, which is at 3 o'clock. It was diagnosed as external hemorrhoids. Patient was then admitted in MSW for further treatment and management. Next slide, please. So systemic examination. When the patient was examined, he was well-oriented, conscious, and in good general condition. All his vitals were stable. His BP was 120/70, which is normal. Pulse rate was 76 per minute, and temperature was around 98 degree Fahrenheit. Next slide, please. Blood investigations. So routine investigations has been done like CBC, CTBT, RBS, HIV, urine routine, and all were within normal limits. Next slide, please. Jaloka application. So I have distributed this procedure in 3 steps like Purvakarm, Pradhankarm, and Paschatkarm. So in Purvakarm, non-poisonous Jaloka were selected, bathed them in turmeric water for detoxification, then cleaned the application site and dried. Next slide, please. In Pradhankarma, I have applied this Jaloka on pile mass present at anal verge. If necessary, the mass at anal verge was pricked by needle to bleed, so that the Jaloka could easily catch and start to suck the blood. When it was confirmed that it started sucking the blood, the patient felt the pricking sensation. Then Jaloka was covered with wet gauze. Process was continued till spontaneous detachment of the leech. Next slide, please. Paschatkarma. Once the Jaloka detached, the bite area was sprinkled with turmeric powder and covered with dry gauze and pad capped and dressing done. Jaloka was subjected to immediate emesis by applying the turmeric powder at their mouth. Next slide, please. So local application, sitz bath has been done with Haridra QID. Next slide, please. Result. So As soon as the leech application was started, patient got relieved of pain and tenderness. His agony and discomfort level was also reduced. After second setting, the size of external hemorrhoid were also reduced. After third setting, he was completely relieved and satisfied with the treatment. That's why he got discharged with giving proper diet instructions. Next slide, please. Follow-up. The patient was followed up after 7 days in OPD. He was much satisfied and happy. On examination, it was seen that the mass, that is hemorrhoids, at anal verge completely reduced in size. On PR, there was no pain and swelling, and the rectum was also not loaded. Next slide, please. Discussion. So in external hemorrhoids, there is an engorgement of the hemorrhoidal vessel with acute swelling, which may allow blood to pool, which subsequently clot. Leeches act as anticoagulant, vasodilator, thrombolytic, anti-inflammatory, and analgesic substance, which has been proved as a medical device through their sucking effect. That's why we have used leeches here. Leeches stimulate circulation of cell at risk of necrosis and maintain oxygenation of tissue. Therefore, it promotes the restoration of capillary anastomosis. Conclusion. So, we have concluded that Jalokavcharan helps to improve blood circulation in blocked veins by removing pooled blood, and so results in marked reduction in pile mass, pain, and tenderness. Leeches have been proved to be very effective in the management of external hemorrhoids. Next slide, please. So here we have done in the first setting, you can see quite swelling at the anal verge. In second setting, the swelling is quite reduced. And next slide, please. This is the third setting after Jalokavcharan. So these are the references which I have used. Thank you.
Thank you, doctor. Next, I invite Dr. Snehal Sanjay Lokhande for the paper presentation.
Yeah, yes, sir.
Okay, Dr. Snehal. Good evening, doctor.
Yeah.
Please
Good
share
evening,
the
sir.
screen, doctor.
Good evening, all of you. Myself, Dr. Snehal Sanjay Lokhande, final year student of Prasuti Evam Stri Rog from YSC Kodoli. My today's topic of discussion is importance of Rajaswala Paricharya in the maintenance of female health. Next slide, please. The ancient medicinal science, Ayurveda, focuses on the study of maintaining health and life as well as the treatment of disease when it is manifest. A special importance is given to Stri and also has been said in our Shastras, Yatra Naryastu Pujyante, Ramante Tatra Devatataha. Stri is known as embodiment of the divine. Hence, Stri Swasthya is given highest priority by the great Acharyas. Next slide, please. The female who is menstruating is termed as Rajaswala. Rajaswala Paricharya in different Sahitas as mentioned. तथा पुष्पात प्रभृति त्रिरात्र मासित ब्रह्मचारिण्यधा शाहिनी पाणिभ्याम अन्न जर्जर पात्रात भुंजाना न च कांचन मृजानाम अपद्यते by चरक शारिस्तान 8/15 according to आचार्य सुश्रुत ऋतो प्रथम दिवसात प्रभृति ब्रह्मचारिणी दिवा स्वप्न अंजन अश्रुपात स्नान अनुलेपन अभ्यंग नखच्छेदन प्रधावन हसन कथन अतिशब्द श्रवण अवलेखन अनिलसायन परिहरेत दर्भ संस्तर शायिनी करतल शराव पर्ण्यान भोजनी हविष्यम त्र्यहम च भर्तु संरक्षते. Next slide, please. It is very difficult to follow the regimen as mentioned. In past few years, there has been a drastic rise in the menstrual problem and infertility, which is producing as a major threat to the present day population. In present era, symptoms like lower abdominal pain, backache, mood swings, nausea, etc. are considered as associated symptoms of menstrual cycle as normal. But our texts have mentioned that a normal menstruation should be devoid of pain, burning sensation. So this study aims to find out the effect of Rajaswala Paricharya on the menstrual health. Next slide, please. The female who is menstruating is termed as Rajaswala. The duration of menses has been told as ranging from 3 to 7 days according to Ayurvedic classics. The female should follow certain do's and don'ts regarding the ahar, vihar, mansik aspects for 3 days of menstrual cycle known as Rajaswala Paricharya. Unfortunately, it has been observed that the Rajaswala Paricharya is neither being publicized nor followed by the women in modern era. Women have become career oriented and have stood up to the level of men in all the fields, due to which the life of women has turned hectic and stressful. There is a major importance given to the food habits during those days, which has almost vanished. Conventional medical system only thrust on sanitation and hygienic. Next slide, please. Rajaswala Paricharya and their scientific validation. Brahmacharini, vaginal section without precaution during or shortly after heterosexual transmission of HIV or other sexual transmitted pathogens, and the subsequent development of STDs affecting inter alia and the health of the reproductive tract. Infection from chlamydia and gonorrhea are important preventable causes of pelvic inflammatory disease and infertility. Next, please. हविष्यम भोजिनी. हविष्य म्हणजे शाली, घृत, तक्र, यवक, etc. Functional ingredients in barley grains is having efficacy for preventing chronic diseases. Barley grains can improve bowel health and metabolic syndrome, prevent heart disease, and accelerate wound healing activities. Antioxidants are compounds that remove reactive oxygen species from cells, which play a dual role in aggravating and preventing diseases. Shastik shali contains some amount of nitric oxide, which increases the blood flow to the uterus. Next, please. Darbha Sanstar Shayini. Sleep on made up of darbha. Darbha grass has been shown on block X-ray radiation in recent medical studies. It is also believed that wearing or sitting on darbha will prevent the energy generated during mediation, which being released into the ground. Darbha grass had stunning nano patterns and axial nano or microstructures that were absent from other grasses when electron microscopy was used to examine them. Next, please. Kalyanadayini, thinking about positive things. To regulate the menstrual cycle, the estrogen and progesterone also are pillar hormones. On abundance of estrogen receptors at several locations related to cognition in the CNS. Optimism is commonly believed to be protective factor with regards to well-being and physical and psychical health. One study have concluded that one day of the menstrual cycle elevated stress was associated with suppressed estradiol across broad region of the cycle. This finding provides direct evidence for an inhibitory effect of psychological stress and ovarian hormone production and associated fecundity in women. Next, please. Tikshna Ushna Amla Lavanani Varjayat. Concerning dietary factors, several studies have analyzed the possible influence between the consumption of certain foods and menstrual pain, highlighting the potentially protecting role of increased consumption of fruits, vegetables, fish, and dairy products against menstrual pain. One clinical study has concluded that positive correlation between the number of times fast food, burger, pizza, potato chips, etc. was consumed by girls and the total score of menstrual distress in the bleeding phase in such a way that an increase in their consumption increases menstrual distress sign. Next. Bathing changes the temperature of the body. It is predictable that there is a mutual interaction between the neural circuits that regulate energy balance, body temperature, and reproduction. The hormonal changes across the menstrual cycle not only directly control reproductive events in women, but also exert effect on other physiological systems, including thermoregulation. These effects may represent a systemic approach to creating an environment conducive to implantation, survival, and development of an embryo. Next, please. Eat in unbroken clay vessels. Considering the Mother Nature has a cure for everything, the assessment of natural element such as this clay should be considered for health. Clay has alkaline properties, so utensils made of clay neutralize the pH balance of the food by interacting with acid in food, thus enhances the digestion. Next, please. Overexertion. One study suggests that intense exercise has been reported to cause luteal phase defect, oligomenorrhea, and other menstrual dysfunction and amenorrhea. Numerous studies have demonstrated that athletes who engage in intense exercise suffer from oligomenorrhea and amenorrhea, and those who engage in moderate exercise are slightly more likely to have longer periods. Next, please. Avoid day sleeping. One survey study reveals that although menstruating women are likely to show increased disturbance during the luteal phase, those with other more severe PMS are more likely to experience luteal increase in daytime sleepiness. Next, please. Importance. All the Paricharia have been mentioned for human being will helps to boost immunity. Same as Rajaswala Paricharia will also helps to maintain proper at most. Rajaswala phase or the period of the menstruation is the phase when follicles are recruitment for the next cycle and the dominant follicle will be chosen. Following Rajaswala Paricharia not only helps the woman to adapt to the physiological and psychological changes occurring in the body during menstruation but also helps in conceiving healthy offspring. Next, please. Rajaswala 3 can be marked by a person who has undergone Shodhan procedure, who is having Agni Mandya and person having Prithvika. Menstruation can be stated as monthly Shodhan procedure. During this period, the mind and body undergo period of purification and detoxification. After Shodhan procedure, Agni of an individual get decreased. So during Rajaswala Paricharya, Havisha and food offering to holy fire is advised to increase the Agni. Next, please. As those female cannot follow proper Rajaswala Paricharya where monthly Sharir Shodhan might not be achieved, in those cases there can be risk of occurrence of Prameha, gestational diabetes, PIH, various autoimmunological disorder, etc. in future. Hence, lifestyle modification or correction is the primary at almost interventional for prevention and treatment of such menstrual diseases. Next, please. Conclusion. Rajaswala Paricharya is perfect model of Nidan Parivarjan Chikitsa, prevention of disease so by following Paricharya. So if female follows Paricharya, female can avoid menstrual disorders and counteract the negative effect of our current way of life on reproduction. Aim of this is to avoid visheshan of Vata and Kapha, prevent formation of Ama and restore energy. Most neglected Paricharya, Rajaswala Paricharya, if followed during menstruation, it will help women to respond healthily to the drastic physical and mental changes during menstrual cycle and in relieving symptoms associated with it. Next, please. Thank you.
Thank you for the presentation, doctor. We will appreciate your work. Next, I invite
Thank you.
Dr. Bhagishri Chavan for the paper presentation. Dr. Bhagishri, are you there?
Yes, sir. Good evening to all. Please share my PPT for paper presentation.
Sure, doctor. We will share for you. Please start the session, doctor.
Good evening to all. Management of the Jirna Amavata, chronic rheumatoid arthritis. It is an case study. Please, next slide. Amavata is a progressively debilitating condition similar to rheumatoid arthritis that occurs in nearly 1% of population. It is the commonest among chronic inflammatory joint disease in which joint becomes swollen, painful and stiff. Due to its chronicity and complications, it has taken the foremost place among the joint disease. As per modern medicine, anti-inflammatory steroids and disease-modifying anti-rheumatoid arthritis, anti-rheumatoid drugs are required, which are not free from the side effects but useful in acute and acute on chronic condition for pain management and somehow disease progressions. So it is basically managed by integrated approach, that is logical use of modern medicine initially in acute stage so as to increase patient compliance and pain management, and side by side mainly by Ayurveda for management of decreased disease progression. Next slide, please. Patient's information. Patient name XYZ, age 51-year female, residence of Mumbai, Ritu Sharath, occupation housewife. History of previous hospitalization. Patient was first visited in OPD 16/8/2021. Patient came on wheelchair and was managed on IPD basis. Accordingly, in between, patient was free of symptoms after discharge. Now on 21/10/23, patient came to OPD with following complaints. Known case of rheumatoid arthritis, Amavata, since 10 years, 2014, and no other specific past medical and surgical history. Next slide, please. Complaining of bilateral interphalangeal joint pain and swallowing, Ubhay Parva Sandhishul, since 1.5 month, bilateral knee joint pain and swelling, Ubhay Janu Sandhishul, since 1 month, bilateral ankle joint pain and swelling, Ubhay Gulfa Sandhishul, since 1 month, low back pain, Katishul, since 2 months, difficulty in performing day-to-day activities since 1 month, morning stiffness and Daurbalya. Duration of onset of symptoms started with jwara, fever, 2 months ago. Later symptoms gradually increase, pain to such an extent that patient unable to do her daily work. Also, kriya kashtata, and since last 10 days before admission, pain tremendously increased so that patient was unable to walk, stand, or do normal movements of joints. Patient scale shown in picture: no pain, mild pain, moderate, severe, very severe, and worse pain. General examination: nadi 86 per minute, mala asamyak, mutra samyak, जिह्वा साम, कोष्ठ मंद, दृक अविशेष, निद्रा खंडित, नख अविशेष, त्वक क्षरत्व, स्पर्श उष्ण, and BP 110/70, सत्वहीन. प्रकृती कफपित्तज. नेक्स्ट स्लाइड प्लीज. निदान पंचखियर हेतू अत्यासन, दिवसवाप, अग्निमांद्य, आहार सेवन अँड अव्यायाम. पूर्वरूप: ज्वर, संधी गौरव, संधी स्तब्ध, शूल, शोफ. रूप: लक्षण एज अबव. संप्राप्ती: हेतु सेवन एज अबव. आमोत्पत्ती: सामवायू निर्माण and अपान दृष्टी. गती टू आम, सर्व शरीर संचार. संधी स्त्रीत क्लेद निर्माण. स्नेह संश्रित अग्निगौरव. आम संचारित्व. संधी प्रदेश शूल and आमवात. निदान डायग्नोसिस: जीर्ण आमवात, रुमॅटॉइड आर्थरायटिस. नेक्स्ट स्लाइड प्लीज. स्पर्श: शीत, अनुष्ण, उष्ण. स्पर्श ग्रेड दिले त्याच्यामध्ये 1, 2, 3, 4. अबसेंट, माइल्ड, मॉडरेट अँड सिव्हिअर. ऍबसेंट म्हणजे काहीच नाही. ओके. ग्रह मध्ये सेम ॲज ग्रेड 1, 2, 3, 4. ऍबसेंट, माइल्ड, मॉडरेट, सिव्हिअर अँड शोथ. नेक्स्ट स्लाइड प्लीज. लॅब इन्व्हेस्टिगेशन: सिरम युरिक ऍसिड 3.2 mg per dl, ESR 60, CRP 98 and CRP 5.24. Chikitsa: patient was admitted in the hospital around 14 days from 21/10/23 to 3/11/23 under care of Dr. Vishal Thamane sir. Treatment protocol: लंघन जीर्ण आमवात, क्रोनिक रुमॅटॉइड आर्थरायटिस, लाजा, मुगाचं कडण. क्वाथपान मुष्ठा गुडूची शुंठी पानार्थ, त्याचा रेशो 2:2:1 to 250 ml. मुहुर पानार्थ. स्नेहन बाय विषगर्भ तेल, वालुका पोट्टली स्वेद, लेप लोकली विथ शुंठी पावडर and शमन चिकित्सा. स्नेहन शोधन चिकित्सा: स्नेहन मृदू संवहन लोकली ओनली फॉर विषगर्भ तेल, स्वेदन लोकली फॉर वालुका पोट्टली स्वेद, वैतरण बस्ती गोमूत्र प्लस गुड प्लस चिंच कोल त्रिफल क्वाथ प्लस सैंधव 150 ml. पृष्ठबस्ती विथ विषगर्भ तेल, लेप लोकली विथ शुंठी पावडर. इन शमन चिकित्सा: सिंहनाथ गुगुल 500 mg twice a day with warm water. वात विध्वंस रस 250 mg twice a day with warm water. and combination of the Swarna Bhuprati Rasa 50 mg plus Shunti 250 mg, Gudchi 250 mg plus Mustha 250 mg plus Kokilaksha 250 mg plus Raktapachak 500 mg plus Shang Sanshamani 500 mg for 15 days. Combination of powder twice a day with warm water. Sinhanath Gugul, it may act in DMRD for Ayurvedic for Amvata, Kafahara, Agnidipak, Ampachak, Shrotashodhak, Vata Vidvamsra, Shulahara, Yogahara, and Shotahara. In modern medicine, capsule Hisika 2 mg for 5 days, tablet Igurvati 25 mg 1 OD by rheumatologist opinion, tablet Predmit 4 mg BD for 5 days, price D3 60K for weekly once. From above treatment, patient symptoms decreased, but pain at bilateral knee joint, Ubhay Janusandhi Shul was not sustained, so added Dhanyambul Dhara, Ubhay Janu Pradeshi, and physiotherapy given. Local Sandhi Parikshan on examination at admission, on admission and on discharge असं कंपॅरिझन केले जसं की अंश कर्पूर मणिबंध पर्व अँड जानू त्याच्यामध्ये अंश अनुष्ण त्याच्यामध्ये 222 अँड स्पर्शासहत्व ग्रह अँड शोथ ग्रेडिंग केलेत उष्ण 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 अँड आफ्टर ट्रीटमेंट ते सबसाइड झालेत स्पर्श अंश कर्पूर मणिबंध पर्व अँड जानुसंधीचे जे स्पर्शासहत्व आहे ग्रहत्व आहे आणि शोथ आहे सिम्पटम्स सबसाइड झालेत Observation: after Langhan and Kathapana, the patient got relief in chip complaints considerably. The NSAIDs and steroids reduce pain in greater extent so that patient faith and complaints so therapy increase. DMAIDs reduce progression of the deformities and disease progression. Shodhan and Shaman Chikitsa relieves all signs and symptoms, can do joint movement freely. Ayurvedic management provides Vyadhi Pratyanik Chikitsa and cause Samprapti Vighatan and prevent recurrence of disease. Discussion: Amvat cause due to vitiations from Vata dosha and formation of Ama. Mandagni is the main reason of Am formation. So chief purpose of treatment to reduce Am by Ampachan, it metabolism, and to normalize the vitiated Vat and Kapha dosha. Amvat is considered to be an Ama and Rajasabikara Langhan. The first line of the treatment of Amvat help in practitioner of the arm. Hello.
Hello.
Hello, doctor.
Conclusion and take home message. Above case studies show Amvat can be effectively treated by external and internal medicines which reduce the symptoms like stiffness and swelling. This thus improving mobility help in checking autoimmune pathologies. There is need of integration of Ayurveda and modern medicines for management of the rheumatological disorders so as to increase compliance of the patient to therapy, acute and chronic pain management, prevention of deformities, and prevention of disease progress. Thank you.
Thank you, doctor.
Thank you so much, doctor.
Next, I invite Dr. Nikita Gunban Khadekar for the paper presentation. Dr. Nikita, are you there?
Yes,
Dr.
sir. Good
Nikita
evening.
Khandekar.
Hello.
Good evening, doctor.
Okay. Am I audible, sir?
Yes, doctor. Audible, doctor. Please share the screen.
Okay. Okay, sir. Okay. Is it visible, sir?
Yes, doctor. Your screen is visible. Please start the session, doctor.
Okay. Good evening, everyone. Myself, Nikita Khandekar, PG Scholar, Kriyashari Department, GSC Dharashit. My topic name is Modern and Ayurvedic Aspect of Physiology of Speech and Articulation. Introduction. Speech is defined as the expression of thoughts by production of articulate sound bearing a definite meaning. It is one of the highest functions of brain. When a sound is produced verbally, it is called speech. If it is expressed by visual symbols, it is known as writing. And if visual symbols or written words are expressed verbally, it is known as reading. According to Ayurveda, the production of speech is proclaimed as a function of Vata dosha, amongst which precisely Udan Vayu, which is one of the subtype of Vayu, is held responsible for production of speech. When Vayu circulates in the Shabdavahi Dhamani, sound or words are produced. So Acharya Sushrut proclaims that speech in the form of language, music, or any other characterized pronunciation is the function of Udan Vayu. The Udan Vayu, along with the function of exhalation, is responsible for production of sound. Mechanism of speech, coordination between central speech apparatus and peripheral speech apparatus totally concludes the mechanism. Central speech apparatus consists of higher centers, that is the cortical and subcortical centers. Peripheral speech apparatus includes larynx or sound box, pharynx, mouth, nasal cavities, tongue, and lips. Now, development of speech, it includes two stages. First stage in the development of speech is the association of certain words with visual, tactile, auditory, and other sensations aroused by objects in the external world. Second stage, new neuronal circuits are established during the development of speech. When a definite meaning has been attached to certain words, pathway between the auditory area, that is area number 41, and motor area for the muscles of articulation, which helps in speech, that is Broca's area, number 44, is established. The child attempts to formulate and pronounce the learned words. A production of speech on basis of classical literature. Vaka pravritti, that is initiation of speech, is through the thoughts that emerged in mind, is expressed as a speech. In Ayurveda, the desire to speech is initiated by Udana Vayu. The Pran Vayu perform functions like sustenance of intellect, hriday, indriya, chitta, so as to complete the process of perception of speech. Ayurveda believes speech production, being the attribute of Akasha element, is produced in the vacuum of space, which is the expression of the fundamental elements. Also, Sushrut has mentioned the Swarava Strotas while describing Swarabheda Roga. Another theory by Acharya Panini in his literary work encapsulates the mechanism of speech as a complete phenomena. The decision to speak out certain words is taken by intellect with the instigation from Atma. Accordingly, the Atma stimulates the Mana to produce sound. The Mana instigates the Kaya Agni, and Kaya Agni instigate the Vat. The Vat thus generates speech while being expelled from the chest. Now, role of cortical areas in development of speech. Three important areas. First is Vernix area, that is speech understanding area. Broca's area, that is speech synthesis area. Motor area, peripheral speech apparatus activation. Now we'll see the role of three areas. So first, understanding of speech begins in Vernix area, that is situated in upper part of temporal lobe. It sends fibers to Broca's area through a tract called arcuate fasciculus. A role of Broca's area, speech synthesis. Speech is synthesized in the Broca's area. It is situated adjacent to the motor area, responsible for the movements of tongues, lips, and larynx, which are necessary for the speech. By receiving information required for production of words from Vernix area, the Broca's area develops the pattern of motor activities required to verbalize the words. And role of motor area, By receiving the pattern of activities from Broca's area, motor area activates the peripheral speech apparatus. It results in initiation of movements of tongue, lips, and larynx required for the speech. Later, when the child is taught to read, auditory speech is associated with visual symbols. Then there is an association of the auditory and visual areas with the motor area for the muscles of hand. Nervous control over speech. Speech is an integrated and a well-coordinated motor phenomena. So many parts of cortical and subcortical areas are involved in the mechanism of speech. Subcortical areas concerned with speech are controlled by cortical areas of dominant hemisphere. In about 95% of human beings, the left cerebral hemisphere is functionally dominant and those persons are right-handed. Motor areas includes Broca's areas and precentral cortex, sensory areas, auditory association area and visual association area, and there is Wernicke's area. Here we can see the division of hemisphere done categorically and representational. So in categorical, left hemisphere in right-handed person, the control is over right-hand control and dominance, spoken language, writing language, scientific skills, mathematics, algorithm skills, verbal reasoning, aptitude. Whereas in representational hemisphere, in right hemisphere in right-handed person, the control is over left-hand control and dominance, art, music, awareness, technical specification awareness, dimensional awareness, imagination, insight, creativity, motor awareness. As you can see in the image, two hemispheres divided by the corpus callosum, and accordingly the functions are given here. Here is the flowchart of mechanism of speech. At last, the articulation of sound is conducted. Here are two images. Image 1 is showing repeating a spoken word, whereas image B is showing reading a word out loud. Relevance of Shabda in classical literature. Shabda, being the attribute of Akash element, is produced in the vacuum or space, which is the expression of this fundamental element. It is an exclusive attribute perceived by the sense organ of ear. Shabda is considered as a group of alphabets and vowels which conveys meaning from one person to another. Acharya Charaka has mentioned 4 divisions of Shabda. First is Drushtartha, that is, this type of word remains happening in the past or happenings we have experienced. Adrushtartha, this type of word indicates happenings which we may know but cannot demonstrate. And Satya, it is indication of appropriate meaning. And Anruta, that is, this type is exactly opposite to the Satya. Types of Shabda according to nature. Dhvanyatmak or Ghosharupa Shabda. This sound is produced by hitting on certain objects. Second is Varnatmak or Bhasarupa Shabda. Sound is produced in form of different syllables with the contact of the tongue at 6 different places. That is Kantha, Talu, Murdha, Murdhna, Danta, Oshta, and Anunasik. Tongue as Karmendriya, that is organ of speech. In Ayurveda, 5 Karmendriya were described to perform specific function which correspond to specific Indriya. This mainly serves as the response which is to be seen after proper combination of Mana and Indriya. The Vagindriya or tongue is a Karmendriya which performs the function of speech. It is also known as Jivha, Vani, and Vak. The Vagindriya includes all the organs that are apparatus for the organ of speech. The entire oral cavity includes organs which play specific role in performing the function of speech. In oral cavity at the base of tongue is situated a Kantha Nadi, which is the location of Svaravas Strotas. Dalhan elucidates that the Svaravas Strotasa constitutes the 2 pairs of Shabdavaha Dhamani located bilaterally at 2 sides of the Kantha Nadi. Here we see the applied physiology. First, we see the aphasia. Aphasia is defined as the loss or impairment of speech due to brain damage, developmental disorders, poor development or atrophy of damage of speech center, and aphasia is not due to paralysis of muscles of articulation. Types of aphasia. The simple and convenient clinical classification divides aphasia into 5 types. First is Broca's aphasia or anterior or expressive or non-fluent. Second, Wernicke's aphasia or posterior or receptive or fluent. Third, global aphasia. Fourth, nominal aphasia or anomic or amnesic. 5 other types of aphasia. Fifth, in that motor aphasia, which might be verbal, dyspraxia or apraxia. Sensory aphasia, auditory aphasia or visual aphasia, that is dyslexia, and agraphia. Dysarthria or anarthria. This term is referred to the disturbed articulation. Anarthria means inability to speak. Dysarthria or anarthria is defined as the difficulty or inability to speak because of paralysis or ataxia of muscles involved in articulation. Dysphonia, it is a voice disorder. Often it is characterized by hoarseness and a sore or a dry throat. Hoarseness means the difficulty in producing sound while trying to speak, or a change in the pitch or loudness of voice. The voice may be weak, breathy, scratchy, or husky. Last is stammering. Stammering or stuttering is a speech disorder characterized by hesitations and involuntary repetitions of certain syllables or words. It is also described as a speech disorder in which normal flow of speech is disturbed by repetitions, prolongations, or abnormal block or stoppage of sound and syllables. Stammering is associated with some unusual facial and body movements. Exact cause for stammering is not known. It is thought that stammering may be due to genetic factors, brain damage, neurological disorders, or anxiety. Here are my references. Thank you.
Thank you, doctor. Thank you for the presentation.
Thank you, sir. Thank you.
Next, I invite Dr. Archana Pawar for the paper presentation.
Yes, sir.
Good evening, doctor.
Good evening, sir. Good evening, all. Myself, Dr. Archana Mahadev Pawar, PG scholar, Prasuti and Srirog. My presentation topic is exploring the Rutumati Sri Lakshanas through the lens of modern science. In this presentation, we will explore the Rutumati Sri Lakshanas through the lens of modern science. We will explore the ancient text on women's health and well-being and analyze them in the context of contemporary scientific knowledge. Rutukal. Acharya Shushruta says the Rutukal is of 12 days. ऋतुस्तु द्वादश रात्र भवति दृष्टार्थवा अदृष्ट अर्थवे अप्य अस्ति भाषन्ते. By Shushruth, Rutukal is of 12 days and other Acharya says that it is of 16 days. Next slide, sir. Rutu is the period of ovulation in a female. Rutukal denotes a peak fertility period in woman. According to Shushruth Samhita, Rutukal is of 12 days and other Acharya says it may be of 16 days. Acharya Dallan has explained that first 3 days and last 1 day should not be considered, as initial 3 days consist of menstrual bleeding and last 16 days is not suitable for conception due to the constriction of yoni. Yoni means cervix or vagina. After excluding these 4 days, out of 16, duration of Rutukal is of 12 days. Conception will occur only during Rutukal. Next slide, sir. Rutumati Shri. What is meant by Rutumati Shri? Acharya Shushruth says a woman possessing a healthy yoni, Garbhashay, Shonit, is termed as a Rutumati Shri. Yoni means cervix or vagina. Garbhashay means uterus. Shonit means ovum or reproductive system. Rutumati Lakshanas. Physiological and behavioral changes. By these Lakshanas, one can identify the woman during peak fertility period and plan for conception. Acharya Shushruth says ऋतुमती लक्षणात पीना प्रसन्न वदना प्रक्लीन आत्ममुख द्विजाम नरकाम प्रिय कथा स्रस्त कुक्षी अक्षी मूर्धजाम स्फुर भुज कुच योनी नाभि उरु जगन स्पीचा हर्ष उत्सुक्य पराश्च अपि विद्यात ऋतुमती इति. Next slide. Pina and Prasanna Vadna means attractive face. The word Pina denotes the fat or round or fleshy face, and the word Prasanna denotes the happy or cheerful face. During Rutukal, the woman's face becomes attractive or happy according to Ayurveda. By modern science, estradiol and progesterone are active hormone in ovulatory phase. Estradiol lowers the osmoregulation of arginine, vasopressin, and thirst, and increases the plasma volume, that is oral fluid retention. Due to this high level of estrogen hormone, during that period, woman looks more cheerful, attractive, fleshy, etc. Is the one of the sign of ovulation in females. Next slide. Praklina dvija means moist gums or healthy oral cavity or healthy periodontium. The oral cavity or periodontium or gums are moist and healthy during Rutukal. The periodontium is supporting structures of teeth like gingiva, periodontal ligament, cementum, and alveolar bones. These periodontal tissue have as receptors of sex steroidal hormones, that is estradiol. That estradiol responsible for the healthy periodontium. Sex hormone receptor have been detected in the oral mucosa and salivary glands. There are estrogen receptor in osteoblast and fibroblast. Oral mucosa resembles with the vaginal mucosa in its histology as well as its response to estrogen hormone. Praklina dvija denotes the same healthy periodontium tissue or oral cavity. Next slide. Narakama means the increased sexual tendency during the ovulation period. In many species, female are more sexually attractive to male near the ovulation period. Recent study demonstrate that increase in sexual motivation in women near ovulation period. It is due to the high level of estradiol during this period. Woman appears to be more sexually attracted to men during this mid-cycle, during this ovulatory phase. Next slide. Priyakatham means listening stories or participating in recreational activities. These particular lakshana denotes a positive or cheerful or pleasant or happy mood during Rutukal. Priyakatham denotes the joyful. Next slide. Strastha Kukshi Akshi Murdhvaja means the laxity or flaccidity or postural sway or lordosis. The word strastra denotes the laxity or flaccidity or downward displacement. Strastha Kukshi Akshi Murdhvaja means flaccidity or laxity of the muscle of trunk, eye or and head. Estrogen is one of the primary female sex hormone peaks during the ovulation and has been specifically studied regarding its relationship to the human connective tissue. Human connective tissue such as tendons, muscles, and ligaments are composed of collagen fibers, which are packed closely together. The closeness of collagen fibers gives the greater strength to the muscle and ligament. Next slide, please. Many studies have explained that estrogen has an inhibitory effect on collagen synthesis, which alters the connective tissue metabolism. Decreased collagen synthesis lead to ligament laxity and weak muscle strength because of increased serum level of estrogen, decrease in collagen formation and fibroblast proliferation. Lordosis behavior, which is also known as mammalian lordosis, bend backward or presenting is the naturally occurring body posture for the receptivity of copulation seen in the most mammals. Next slide. Spurati Bhuja Kucha Shroni Nabhi Uru Jagana and Spicham. The word Spuran denotes the queering or expansion or shining. Various body parts shows Spuran during Rutukal like Bhuja means shoulder, Kucha means breast, Shroni means hip and loins, Nabhi means umbilicus, abdomen or visceral, Uru means thighs, Jagan means mons veneris or vulva, and Spicham means buttocks. All these body parts contain subcutaneous fat depot during fertility period. Due to the underlying excessive subcutaneous fat in the above mentioned body parts, they show the spuran. During ovulation, along with breast, other body parts fluctuate in symmetrically. Next slide. It has been known that estrogen is the major regulator of adipose tissue development and deposition in the male as well as female. Fat accumulation in different efforts is sexually dimorphic. Men accumulate more visceral fat, whereas women accumulate more subcutaneous fat, and women possess a higher percentage of body fat. Morphological features such as overall body fat distribution, breast size, and hip width have been proposed to influence female attractiveness and desirability. Estrogen promotes the accumulation of subcutaneous fat. Estrogen regulates body fat distribution and facilitates fat mobilization. Next slide. Harsha and Austukya. Pleasure, delight, or excitement. Both Harsha and Austukya denotes positive, cheerful mood and also explain sexual receptivity and prospectivity. Positive mood peaks during ovulation period and woman shows more interest in men, displayed more flirting, sexually provocative behaviors. Thank you.
Thank you, doctor. Thank you for the wonderful presentation.
Thank you, sir.
Next, I invite Dr. Pranida Kelwar for the paper presentation.
Yes, sir. Good evening, sir. Am I audible?
Yes, doctor, you're audible. Please share the screen, doctor.
Can I have sent a PPT presentation? Can you share that for me?
Okay, just a moment, doctor. Dr. Pranita,
Yes, sir.
start the session.
Yes, sir. Hello, everyone. Good evening. My name is Dr. Pranita Gatlevar. I'm a PG scholar. My guide's name is Mitesh Joshi, sir. He's Associate Professor, Department of Swastha Vritti and Yoga, Sumati Bai Shah Ayurved Mahavidyalaya, Hadapsar. My topic for today is finger millets, that is ragi, and it's a journey from hypercholesterolemia to health. So, next slide, please. Introduction. In today's era of climate changes, nutritional demands of rising population and marginal farming and poverty, millets are said to be the smart food as they are good for health, good for farmers, and good for the planet. Finger millets, also known as ragi, nachni, or nartak, have a rich history in India dating back to 2300 BC. This review focuses on the nutraceutical impact of finger millets in hypercholesterolemia characterized by high cholesterol level in the blood. In Ayurveda, cholesterol is associated with Med Dhatu. While normal Med Dhatu levels are crucial for proper bodily function, the accumulation of arm in Med Dhatu can lead to blockages in the channels. The large amount of saturated fats are introduced into the body by junk food and other unhealthy food made from refined flour and fatty ingredients. Lipid metabolism is severely hampered in such individuals. In conditions like hypercholesterolemia, where good and bad cholesterol levels are already disturbed, the healthy ragi could be beneficial in the form of patya kalpanas, that is recipes. Next slide, please. So botanical name of ragi is Eleusine coracana. The left side, I have presented taxonomical classification of the ragi. Kingdom is Plantae, phylum Tracheophyta, class Liliopsida, order Pole, family Poaceae, genus Eleusine, and species Coracana. Rasapanchak of Ragi, it is Kashaya Dikta Madhur Rasatmak, Katu Vipak, Sheet Virya, Tridoshagna Rakta Doshahar, Lagu and Ruksha in Gun, and has Balya, Vrishya, and Lekhaniya Karma. Next slide, please. Here I have presented nutritive profile of ragi. As we can see, the third column in the first table, fat per 100 gram is 1.3 grams. The second table shows fatty acid profile of ragi. As you can see, the saturated fat content is less comparative to unsaturated fatty acid and polyunsaturated fatty acids. Next slide, please. Discussion. In Ayurveda, diet plays a major role in preventing illness and promote health. In Charak Samhita, different groups are mentioned under Ahar Varga. Acharya Charak refers to millet as Kudhanya, that is inferior among cereals, and are described under Shukdhanya Varga. Acharya Sushrut has separately explained Kudhanya Varga. Millets are mentioned under Dhanya Varga by most Acharyas, while some call this group Shudra Dhanya, small size cereals, or Trinadhanya, that is grass derived cereals. When excess unhealthy food is taken regularly, Jatharagni is affected and weakens. Upon repeated consumption of unhealthy diet, that is undigested toxic substance get accumulated in the strotus, leading to Strotarod, that is blockages of channel, which is the main culprit in Samprapti of Medorog. The Sama Med Dhatu flowing in the bloodstream causes obstruction in already constricted vessel. This condition in modern medicine can be correlated with hypercholesterolemia. In such condition, Kashai and Tiktaras present in Ragi helps in digestion of Ama. Rukshagun helps in digestion of in scrapping out the excess fat. Ragi is Tridoshagna and this helps in clearing Sotadushti. Due to such properties, Ragi can be added to the daily diet in different forms under after undergoing processes like germination, fermentation, puffing, malting, etc. The fermented ragi's production of high statin levels add a valuable dimension to its hypercholesterolemic properties. Recipes like ragi porridge, ragi idli, ragi cookies, ragi dosa, ragi malt, ragi papad could be a healthy dietary menu. The soluble dietary fibers present in ragi lowers LDL cholesterol and lessens the reabsorption of bile acids, which are produced from cholesterol. Another affordable way to obtain essential metabolites for hypercholesterolemia therapy, such as sterol and statin, is through the fermentation of ragi. The cholesterol biosynthesis pathway is inhibited by statins, while dietary sterols lowers blood levels of LDL without compromising HDL, which is good cholesterol. The amino acids named tryptophan, lecithin, methionine, threonine prevents fat formation and removes excess fat from liver. Monounsaturated and polyunsaturated fats are claimed to reduce harmful LDL cholesterol levels, it reduce inflammation and provide nutrients that your body needs to develop and maintain your cells. Next slide, please. Millets in Ayurveda are mentioned as durjara, that is, it delays digestion. Due to its nutritional composition, it provides ample amount of energy and micronutrients. As a result, overeating is avoided and deposition of fat in the body is eliminated. The rushed yet sedentary lifestyle of the present era is giving rise to diseases similar to hypercholesteremia, which comes under Santarpanajanya Vikar, diseases due to overeating, and Kafaj Vikar, diseases due to vitiated kapha dosh. In such scenario, ragi, which has kaphanashak property, can be used as a preventive diet in healthy and therapeutic diet in deceased. Although millets are referred to as foodhanya, that is inferior to cereals by the acharyas, cautious use of millets in diet is important as it can vitiate vadosh. Depending upon the agni of the rogi and the avastha of the rog, dietary modifications should be improvised. Next slide, please. Conclusion. The findings presented in this review highlight the substantial potential of ragi in addressing hypercholesteremia through its nutraceutical attributes. The scientific evidence gathered from Ayurveda texts, research articles, and scientific journals underscores ragi efficacy in reducing bad cholesterol level and promoting the proper function of good cholesterol. The identified kashaya and tiktaras in ragi contribute to the digestion of ama, while the rukshagrun helps balance vitiated fat. These insights not only support the integration of ragi-based dietary modifications for individuals with hypercholesteremia, but also advocate for its culinary use as a versatile, cost-effective, and readily available option. The implications of these findings extend beyond individual health benefits, signaling ragi's potential to bridge the gap between hypercholesteremia and overall well-being. Aligning with the growing recognition of its role in the nutraceutical industry, ragi emerges as a promising and economically feasible nutritional substitute, offering a scientific supported alternative to less healthy dietary practices. Thank you so much.
Thank you, doctor. Okay, next I invite Dr. Danish Malik for the paper presentation. Dr. Danish Malik.
Yes.
Good evening, doctor.
Good evening. Hello, everyone. Myself, Dr. Danish Malik, PG scholar from Shalya Tantra department. My topic is concept of shorthand surgical training with respect to the Yogya Sutra Adhyay. Next slide. Shushruth has very rightly designed and contributed a chapter to learn surgical techniques on object before practicing of similar technique on human beings. He has been emphasized so seriously for new learners to practice similar operation on similar object for obtaining highest rate of success. Otherwise, he cannot be life giver even after truly learned all the scriptures. Next slide. Eight types of the surgical procedure are Chedan, Bhedan, Lekhan, Vyadan, Ishan, Aran, Vishravan, and Sivan, and application of Shar, Agni, and Bandhan have been explained. Next slide. Chedan Shastra Karma. It is a procedure to excise a disease or damaged part by using scalpel and surgical knife. Different Shastra are Madhulika, Karpatra, and Vriddhipatra. Various objects like pumpkin, watermelon, cucumber are mentioned under this karma. Next slide. Second is Vedan Shastri Karma, also called incision and exploration. It is a procedure to be made expose underlying structure and to let out the content by using Shastra, Vidhipatra, Ardhapatra. For example, to manage a case of Pakva Vidhradi, example abscess, and adequate incision and proper exploration are essential steps. So to learn this technique, incision should be practiced on the leather bag, urinary bladder, or leather pot containing full of water and slime. Next slide. Third is Lekhan Karm. Scraping and scooping is being carried out to remove undesired tissue like hypergranulation, epithelialized tissue. To gain clinical experience, Lekhan Karma should be practiced on a piece of hairy skin. It is a very small surgical procedure, but highest attention is needed to avoid the injury to nearby structure. Next slide. Next come is Vidhan Karm, also called as puncturing. It is a procedure to pierce the epithelial surface superficially vein. For this purpose, very fine hand is necessary. So this procedure should be practiced using vein of animal or on the lotus stalks, which are smooth, spongy in nature. This procedure is applicable to remove the fluids from any cavity. Example, abdominal peristalsis. Next slide. Next come is Ishan Karma. The Ishan Karma should be practiced using holes in piece of wood eaten by moths, bamboos, and mouth of dried gods. These materials are containing multiple hole and passages through which a probe can be passed without any resistance or at least of resistance. By this procedure, scholar can be developed clinical skill to assess the pathway of the sinus and cavity in humans. Next slide. Next term is Vishravan Karm. The method is used to remove the abnormal collection of fluid in body cavity to let out the vitiated drug dose. The procedure of Vishravan Karm should be practiced on the piece of salmali wood coated with beeswax. So whenever a scholar intend to practice Vishravan Karm on this model, he will be experienced on how to take a fine incision for free flow of liquid. Next slide. Next term is Sivan Karm. The technique is identified for approximation of the cut margins of wood should be produced by surgical or non-surgical process. The technique should be practiced on the border of fine, closely knitted cloth on the borders of soft leather. Next slide. Next come is Bandhan Karm. Total 14 bandhans are mentioned in Sushrut Samhita. With considering the nature of disease and season, a suitable bandhan help for early healing of crush, lacerated wound, and to stabilize the fracture, dislocation, etc. So that wounded person can sleep well, able to walk and sit comfortably. Next slide. Shar and Agni Karm. Shar and Agni Karm are the most important para-surgical tool mentioned in Ayurveda, but lacking of clinical skill and small negligence, it can produce more hazard to the body tissue. Thus, one who desire to become skilled to use Shar Karm and Agni Karm should practice on similar object like a suitable soft muscle piece, and because the sign of Samyat Dagd can be observed better in muscle piece. Next slide. Miscellaneous procedure. Similarly, to become skilled in other miscellaneous procedure like Basti Karma, Varna Prakshalan, scholars should be practiced on the side of hole of the earthen pot containing full of water or on the mouth of God. Thank you.
Thank you, doctor. So next, I would like to invite Dr. Shivam Katkar.
Yes, am I audible?
Yes, Doctor Audible.
Yes, Doctor.
Can you share my slides, please?
Please, Doctor. Hello, doctor.
Yes.
Please start this. Please start the session, doctor.
Yes. Okay. Myself Shivam Katkar from CRC College, Pune. The topic is modern diagnostic method in Ayurvedic diagnosis. Introduction of the Ayurvedic diagnosis is based on etiological factor. Okay. The Ayurveda classified the madhu nidan. It's classical approaches of diagnosis having more than 5,000 signs and symptoms for the identification of the diagnosis. Okay, next slide. रोगस्तु दोष वैषम्यम दोष साम्य रोगात. Aptopdesh Pratyaksha and Anuman Praman is the method used for diagnosis the state and stage and site of dosh dusha and dosh dusha sammurchana. The materials and methods of diagnosis in Ayurveda. Next slides. The Nidan Panchak is the diagnosis of Ayurveda, that is a Hetu, Purvarup, Rup, Upshay, and Samprapti. Hetu is a causes, Purvarup is a pre-symptoms, as like we see in many diseases, and Rup and symptoms. Upshay is a relief from the disease with the help of physical therapy or remedy, herbal remedies, and Samprapti is a pathogenesis of the disease. Next slide. Principle of Ayurveda Nidan. There are the four principles: Trivid, Ashtavid, Dashavid, and Nadi Pariksha. Trivid is Darshan, Sparshan, and Prashna. By the Darshan Pariksha, we can correlate with some modern diagnostic methods like hematology is a CBC, LFT, sugar, and ABG. X-ray, with the help of we observe the internal structure of the body parts like bones, kidney, stone. UAG, MRI, CT scan, endoscopy, 2D echo, biopsy, and hormonal assay and blood cultures, urine cultures, etc. Next slide, please. Prashna Pariksha. It is an interrogation. With the help of Prashna Pariksha, we get the information about the patient presence, illness, past history, and it is helped to correlate with the instant pathology of the disease and dosha imbalance. The elements of Ayurvedic diagnosis is Hetu, is Mithya Ahar Vihar, dosha. It is a location of doshas, cardinal symptoms, and movement and symptoms of aggregative rumors. Dosha is a genetic defect or a defect in a tissue. Strotasa is a symptoms of whitation of channels. Next slide, please. Agni. Agni we correlate with the indigestion of the matter, and Strotodushti is obstruction on tumor and tumors, and Rogamarga is a vital tissue, bones, joints, and GIT. Confirmation of the diagnosis. If the physician fails to arrive the diagnosis, then we take a help with the confirmatory diagnosis, that is mentioned a Purish Nimejan Pariksha, that is a stool sink in the test, stool sink test, and Dushti Rakta Pariksha, it is the examination of whited bloods. Nantar Mutra Pariksha, it's the examination of urine. Next slide. Shukra Pariksha is the correlate with the examination of the semen, and Artha Pariksha is the examination with menstrual fluid. Utility of a diagnosis is early diagnosis help in a complete and faster recovery. Early diagnosis help in prevention of complication. The accurate diagnosis help in planning precise treatment for destroying the root cause of disease, and thus recurrence of a disease has less chance. Early and correct diagnosis save money and reduce mental stress of the patient. Next slide. Here is some correlation with Ayurvedic that points with the modern labs correlations. Rakta Dhatu is correlate with RBC. HB percent, WBC, platelet count, MCH, MCV, Vat, Vatvruddhi or a Prakop is related to the eosinophil, Rasadushti, Asti, Asti Dhatu is correlate with the calcium and phosphate. Manas Ansa Dhatu is correlate with the serum creatinine. Shukra Dhatu is correlated with the semen analysis, testosterone, FSH, and LH. And Prana Vayu is correlated with PFT, that is a pulmonary function test that we seen. It is a correlation of the Ayurvedic diagnosis with modern diagnosis. Okay, thank you.
Thank you, doctor.
So next, I would like to invite Dr. Yashanjali Santosh.
Good evening. Myself, Dr. Yashanjali, and my topic is NASA Arsha in correlation with nasal polyp treatment. Next slide. NASA Arsha, Aram the disease which gave the pain like Ari or Shatru is Arsha. It can cause anywhere in the body. Sushruti has explained 4 types of Nasha Arsha as following: Vatash, Pittash, Kafash, and Sannipatash. Next slide. Samprapti. The Lakshana explained of Nasha Arsha is Dosha Sata. The Lakshana explained of Nasa Arsha is Sloka, excess rhinorrhea, sneezing, difficulty in breathing, ozena, and nasal sound and headache. Next slide. Management of Nasa Arsha. Ayurveda has described to treat as following: Bheshad, Shar, Agni, and Shastra. Next slide, please. Bheshaj. Those polyps which are not more than 1 year are curable by medicinal treatment. Sushruta has given following yog: Pipayadi yog, Bhallatak tel, and Kutajadi avaleha. Next slide. Shar. Shar is useful in those polyps which are mrudu, prasutra, and extensive of the deeply situated and projecting upwards. The preparation of Shar has been explained in Sushrut Akra. Next slide. Agni. Those polyps which are karsh, rough, stir, firm, pruthu, thick, and cut in hard are treated with Agni Karma. Next slide, please. Shastra. Those polyps which are tanumul, narrow pedicle, uchit, projecting, and clade yukta, moist should be treated with the Shastra Prayog surgical excision. Next slide, please. Detail about nasal polyp. Nasal arsha can be correlated with nasal polyp. Nasal polyp are fleshy swelling. They develop in the nasal lining and in the lining of paranasal sinuses. They are also defined as being non-cancerous growth of the lining tissue and mucosa of the nose. Nasal polyp is a chronic inflammatory disease affecting about 1 to 4% of general population. Next slide. Symptoms: difficulty in breathing through the nose, loss of smell, decreased taste, pain may be occasional, post-nasal drip, a runny nose. Appearance as a smooth, glistening grape-like masses, often pale in color. They are movable, non-tender, and typically in both nostrils. Complication: sinusitis and broadening of nose. Next slide. Pathophysiology. The exact cause of nasal polyp is unknown, but may be due to the recurrent infection or inflammation. Polyp arise from the lining of the sinuses. Nasal mucosa in the region of middle meatus becomes swollen due to collection of extracellular fluid. Extracellular fluid collection from polyps and protrusion in the nasal cavity or sinuses. Senile polyps become pendiculated due to gravity. Next slide. Type of nasal a polyp. Ethmoidal polyp. Ethmoidal polyp arise from the ethmoidal sinuses and extend through the middle meatus into the nasal cavity. Antrocanal polyps. Antrocanal polyps usually arise in maxillary sinus and extend into the nasopharynx. Next slide. Diagnosis, physical examination, anterior rhinoscopy and posterior rhinoscopy. Anterior rhinoscopy finding, nasal polyapparence is visible mass in the nostril. Recently, nasal endoscopy is used to diagnose the posterior nasal polyps. Next slide. Grading of nasal polyps, nasal polyps grading system, polyp grading system, right nasal cavity. Score 0, no visible nasal polyps. Score 1, confined to the middle meatus. 2, score 2, multiple polyps occupying middle meatus. Score 3, extending beyond the middle meatus. And score 4, obstructing nasal cavity. Next slide. Treatment. According to the modern, recently polyps are treated with the polyectomy, rarely used face surgery, and the laser therapy and cryotherapy. Next slide. FESS face functional endoscopic sinus surgery. Nowadays, advanced endoscopic sinus surgery for ethmoidal polyps is popularly used. It is done with the various endoscope of 0 degree, 30 degree, and the 70 degree angulation. Polyp can be removed more accurately when ethmoidal cells are removed and drained, and the ventilation provided to the other involved sinuses such as maxillary, sphenoidal, or frontal. Face is minimally invasive procedure that is performed using an endoscope, a thin rigid tube, and the camera of the end. The endoscope is inserted through the nostril, allowing surgeon to visualize the inside of the nasal passage and the sinuses. Next slide. Procedure, anesthesia, local anesthesia or general anesthesia in uncooperative patient. Procedure, using endoscope gently entering in the nose. Surgical tools alongside the endoscope is used to remove bone, diseased tissue or polyps that are blocking the sinuses. A small rotating blur is used to scare out the tissue. Nasal packing is done if required after the hemostasis achieved. Post-operative antibiotic, local anesthesia, decongestant, SOS, and anti-inflammatory and supportive treatment. Next slide. Laser therapy. It uses an endoscope and the laser devices. Laser therapy of nasal polyps has the advantage of less bleeding, non-post-operative packing of the nose needed, and the lower post-operative recurrence rate. Laser therapy is better than a surgical removal in the treatment of nasal polyps due to its advantages. Next slide. Procedure, anesthesia, local or general. Procedure, using endoscope, gentle entering in the nose. Cutting and cauterization is done with the help of laser device. Nasal packing is less required as hemostasis is achieved with the laser devices. Post-operative antibiotic, local nasal decongestant, as well as anti-inflammatory and supportive treatment. Next slide. Cryotherapy. It is used in endoscope and cryotherapy device to freeze nerves in nasal passage. When the cold temperature hit the nerve signals and interrupted and no longer tell the nerves to swell, drip, and run. Next slide. Procedure, anesthesia, local anesthesia or general anesthesia. Procedure, using the endoscope gently entering in the nose. A probe with the camera will place into the nose. The drip of the nose uses intense cooling between the sinus 4 and minus 148 Fahrenheit. Nasal packing is done if required. Post-operative antibiotic, local nasal decongestant, SOS, anti-inflammatory and supportive treatment. Next slide. Discussion. In Ayurveda, Nasa Arsha can be treated with Chaturvid Upay. In this shar act by coagulation with
can be correlated with the coagulation action of the laser. Agnikarma can be correlated with the electrocautery, in which heat is used to cut and seal the bleeding point. Latest advanced technology like laser cryosurgery are safest amongst the current modes, as they are bloodless and prices and the time saving. Next slide. Conclusion: any sufficiently advanced technology is indistinguishable from the magic, said the famous scientist, fiction writer, and futuristic author C. Clarke. The most valuable advancement are considerable to be the field of healthcare, because it has led to the saving of numerous lives and that too painlessly. Using technology in the creative procedure of surgery evaluate the level of the precision and efficiency of the surgery, which could have been possible in the absence of technological advancement. In the advanced technology are helping making its use is less painful than the traditional treatment. They should be adapted by us. Next slide. Here is mentioning the references I used. Thank you.
Thank you, doctor.
Thank you, doctor. Thank you for the wonderful presentation.
Pleasure.
Next, I invite Dr. Yogesh Gaikwad for the paper presentation on the topic Vardhakya Vyadhi. Dr. Yogesh, are you there?
Yes, sir. Good evening, everyone. Myself, Dr. Yogesh Bahasab Gaikwad from Kajikisa Department, YMC Kololi, Kolhapur. So here I present the topic Vardhakya Vyadhi, or also called as a geriatrics in modern medicine. Before starting the session, I will talk about the theory of aging. There are three mainly acceptable theories of the aging: somatic nutrition theory, autoimmune theory, and Hayflick's theory of aging. So, somatic nutrition theory, which tells us that there are certain metabolic activities in our body which produces the free radicals. These free radicals damages the DNA, cell membrane, and proteins. At the age progresses, there is an increase in amount of free radicals, which also increases the result agings. Problems of geriatric age group nowadays people face. Health problems, we can see joint problems, impairment of special senses, cardiovascular diseases, hypothermia, cancer, prostate enlargement, diabetes, and other comorbidities like hypertension, accidental falls actually. Psychological problems, we see emotional problems, suicidal tendencies, senile dementia, Alzheimer diseases. Social problems, we can see as poverty, loneliness, dependency, isolation, and elder abuse, and generation gap. Medical care or management we can give for old age people. There are totally 6 aspects in which we can see preventive geriatrics, specific management for medical condition, rehabilitation, Satvauja Chikitsa, Yukti Vyapavrasha Chikitsa, and Deva Vyapavrasha Chikitsa. First aspect of talking about preventive genetics, primordial prevention, which includes pre-genetic care, primary prevention, health education, exercise, yoga, and Atma Vidya. Secondary prevention, we can see annual medical checkups, early detection and treatment of the diseases. Tertiary prevention, we can see counseling and rehabilitation, welfare activities, Sanjay Gandhi, there are other yojanas like the yojanas, chiropody services, and improving quality of life by culture program, old age clubs, meal on wheels, old age homes, etc. Genetic rehabilitation can be done in order of short and long-term nursing periods for old people in need of medical care. First, preventive treatment and medical rehabilitation must be the main priority of the measures. Geriatric rehabilitation is subdivided into 3 aspects: prophylactic rehabilitation, general rehabilitation, target-specific rehabilitation. On the whole, it has been reckoned that older people need a distinctly longer period of recuperation, in which a clinical picture that the age is the decisive factor of successful rehabilitation. Genetic healthcare in according to Ayurveda, we call as a Vridhapacharniyam, where Jara Chikitsa is one of the among the 8 branches of the Ashtanga Ayurveda. They are also known as Kaya, Bala, Graha, Urdhvanga, Shalya, Drashta, Jara, Vrusha. It deals with the disease of condition associated with the old age. Ayurvedic geriatric procedures are aimed to cure the physical, emotional, and behavioral disturbance with the help of the well-planned Ayurvedic Chikitsa. Procedures like Panchakarma, Rasan Chikitsa, and Vajikaran Chikitsa. Jara Chikitsa is also called as Rasan Chikitsa or rejuvenation therapy because it aims at the revitalizing the body tissues for the youthful being. Chikitsa Paddhati according to Ayurveda, Hitacharya, Dincharya, Ritucharya, Ratricharya, the Rasayan Vajikaran, Manusopchara and Ahar Rasayan, and Vyadhi Pratyanik. Hitcharya, we can see a major pair where uh, Charak Charak Acharya spelled out where one सूत्र that नगरी नगरस्य रथस्य रति सदा स्वशरीरस्य मेधावी कृत्यावेश वहित भवेत. It explains that like how king protect his kingdom, charioteer protects his chariot. Like that only, your people, man should protect his its health. Uh, and also Gangadhar Shastri commented on that or above was that opines that measures discussed are especially meant for the Jiv Rakshana and sustenance of the life by adopting Hitacharyas and avoiding Ahitacharyas, thus striking an equilibrium between the psychosomatic element. Dincharya and Ratricharya, the daily regimen of the maintenance of Ayu, Bal, Pushti and Swastha, example Daiva, Pujnam, Abhyanga and Nasya. Ritucharya, we can see that the seasonal regimens for maintaining the dosamya, Dhatu Pushti, Indriya and Sattvabala, and especially for preventing the seasonal disorders. Sadvrutta include Dharma Charan for Meda, Sattva, Pushti and Ayu, Dharniya, Adharniya Vegas, Ahara like Nityopyogi Ahar, Hit Ahar and Matravrat Ahar. Rasayan Vajikaran Chikitsa, here Sharangdar Acharya notes that with each passing decade, the body loses one of the following factors like childhood losing at 10 years, growth after 20, luster and complexion after 30 years, intelligence after 40 years, skin health after 50, strength of sight after 60 years, virility and valor after 70 years, discrimination after 80 years, and sensory perception after 90 years. Rasayan Vajikaran is meant to enhance health and ojas, hence revitalizing tissues that we wore out or in the process of wearing out due to factors like disease and aging. Rasayan Vajikaran Chikitsa enhance immune system, arrest aging, give luster to the skin, give youthful energy, nourishes blood and body tissues like Saptadhatus, and eliminate senility and other diseases of old age. To conclude, this therapy include immunomodulation, antioxidant action, prevents bioxidation there by checking age-related disorders, autoimmune disorders, degenerative disorders, and adaptogenic effects, and so on. Charak Chikitsa Rasayanadhyay, first part, there is a 72 number sutra. It spells as Asa Prayojita Chayanam, Suvriddhi Abhuta Punarvayu. It uh, it spells the implementation of Chavanprash. So Vyadhi Pratyanik Chikitsa, wherein the specific Chikitsa explained the Rogadikar have to be followed. Selection of yogas may be done after considering the factors like Thyema Dhatu Avastha, Sukumaratva, Dorbalya. Hence, management may be done using maximum dosage having maximum efficacy, modifiable Aushad 7 Kal and Aushad Matra, prescription with minimum adverse effect, adequate supervision of long-term medications, therapeutic procedures like Panchakarma to be done after thorough evaluation. Manusopchar and Acharasayan, Vardhakyavastha invariably presents with psychosomatic afflictions like Glani, Sahat, Nidra and Tandra, Alasya, Nirutsaha, Samardha Chestok, Sharira and Manas. Implementation of Manodosha Aushad Sangraha like Dhi, Dhairya, Atmadi Vidna, Sattvaja Chikitsa, Daiva Paprasha Chikitsa. Rasayan drugs include Rasayan drug according to Prakriti Pariksha. Like Vatpradhan Prakriti should be given as Shir, Pitta like Gruta, Kapha Prakriti should be given Madhu, Rakta Prakriti like Sitodak. Other available rasayan drugs are Chawanprash Balatak rasayan, Loha rasayan, Trifla rasayan, Shilajatu rasayan, Inmutra vikara, Pipla Vardhaman Pipli rasayan, and Kapikachu Shivagandha. Lastly, we can speak about the Medha rasayan. In Charak Sutra 4, Madhukaparni Swaras, Yashtimadhu Churna with milk, Guduchi Samu Swaras, Shankapushpi Kalka. Thank you, sir.
Thank you, doctor. Thank you for the wonderful presentation.
Thank you, sir.
We have come up to the end of first day of Prithvika National Assembly presentation. Today's presentations were all commendable with each topic well explained. We extend our appreciation to all presenters for their excellent contributions. I would like to invite Dr. Aishwarya Aras to conclude the session. Dr. Aishwarya, are you there?
Yes, thank you, Dr. Sabin.
Okay, doctor.
So, dear all, it's been a innovative and groundbreaking session, and we will expect this more for the coming days. So, before winding up this session, I take this opportunity to thank our esteemed faculties and the presented our dearest participants. We'll meet tomorrow. Thank you all and good